Good morning, everyone. Wellness is the complete integration of body, mind, and spirit. The realization that everything we do, think, feel, and believe has an effect on our state of well being. When health is absent, wisdom cannot reveal itself, art cannot become manifest, strength cannot be exerted, wealth is useless, and the reason is powerless. Our bodies are our gardens, our wills are our gardeners. It is very much essential to be aware of our health related issues and the measures to be taken to avoid or control it and maintain a healthy lifestyle. Ladies and gentlemen, a very good morning. SRN Adarsh College, in association with NSS and Sexual Harassment Elimination Cell, in collaboration with Oracle and ICS volunteers, has organized breast cancer awareness program and lung cancer awareness program. I, Chandana M. from Department of Commerce, welcome everyone to this program. Light is a symbol of brightness and prosperity. As sunlight expels the darkness, blessings bring prosperity and happiness in our life. Now I request all the dignitaries on the dais to light the lamp. Thank you, dignitaries. Being a good leader isn't about having power over others, but instilling the powers in others. We have such leader amongst us. It's my privilege to welcome our beloved principal, Dr. Shakuntala Samuelson, to welcome the gathering and introduce our today's chief guest.
Good morning. It is my privilege to welcome several dignitaries today. We want to thank and welcome the Indian Cancer Society, the team that has come, headed by Madam Amrinder Kaur and Yuvaraj, who will be helping us with events for today. We want to thank our sponsors, the Oracle team that is there, the CSR team from Oracle, headed by Dr. Kabaldeep Peter, who will be sharing with us. We are so thankful that you are here. We also thank our resource person for today, Dr. Matangi Padmanabhan, who will enlighten us on the various awareness that we should have on the different types of cancer. If you look at the calendar of events for different months, you'll find that every month of the year is devoted to one cancer awareness so that the world knows about it. And the month of November is specially devoted to the lung cancer. Maybe because of the pollution, the extra pollution that is there in the air, which along with the climate can make breathing difficult. For almost 2 years, we wore a mask. And I think many of us were quite healthy. And after removing the mask, we are inhaling a lot of pollution and probably coming down with a lot of sicknesses. Historians say that almost 3000 before Christ, BC, cancer is recorded in history. The Egyptians believed that it was a curse from God. But much later, in 460 BC, Dr. Hippocrates, who was a great physician, gave and coined the name carcino, which stands for cancer, and he called all tumors as carcinogenic. But then today, we know that that is not so, that the earlier a cancer is detected, easier the cure. Many types of cancers are curable. But then we are all scared to even go for a test because we are scared about the report that will come. We are more scared about the time that is taken for the report. Today, if the test is done and the report comes 3 days later, those 3 days, I'm sure we don't sleep. Okay, so those of us who have gone through this will know that these are unnecessary fears, and so we are very thankful to Indian Cancer Society. We are thankful to the Oracle team for the resource people who are here for coming today, and hopefully at the end of the session all the fear will be gone and we will be healthy, and we have the awareness so that our families are taken care of. If we are healthy, women are healthy, the homes are happy. So a home where a woman is healthy is a home that is a happy home. So we welcome you, and I hand over the dais to the resource people. Thank you.
Thank you, ma'am. Now I request Ms. Amarendra Kaur, consultant from Indian Cancer Society, to provide the introduction about today's program to the August gathering.
First of all, hearty thanks for agreeing to have this program here, ma'am. Because at Indian Cancer Society, if you look at our Stanley banner here, we are basically into awareness, early cancer detection, and patient support. Those are our three main areas where we are concentrating all our efforts. So awareness is something that is very different, as we were just talking, Dr. Prashant and myself. It's very different from education. So all of us are here, very well educated, very well achieved, but I don't know where we make the distinction between awareness and education. We are not always aware of everything. So thank you, Dr. Matangi, for helping us bring the right awareness around cancer here to the college students and the staff. So this program today here is not just awareness about cancer, it's also about internalizing the facts so that we can apply them in our lives. And to do that, we sometimes need a little more than, you can read all this information online, but you need a little more than that. You need a push. You need a soft nudge to do the right things for yourself. And we hope that today we will be able to achieve that with not just the talk, but a little extra activities after that. Right? That's all from my side. Thank you.
Thank you, ma'am. And now I request our dignitaries to honor our chief guest with a token of respect, gratitude, and affection. The doctor of the future will give no medicine, but will interest his patients in the care of human frame, in diet, and in the cause and prevention of disease. With this quote, I would like to call upon Dr. Matangi Padmanabhan, radiation oncologist, senior consultant and in charge in BGS Global College, Bangalore, to address the gathering. Over to you, ma'am.
Good morning, everybody. So you might be wondering, she gave me an introduction first, Dr. Padmanabhan. I was a little scared. Okay, Mama. I have studied all my life. Okay, I got all my degree. And somehow my identity is always like Jagannathan's daughter, and then Padmanabhan's wife, later Sudarshan's mother. Where am I? Or somebody, some later, some blah blah blah's grandmother and grandmother. When am I Dr. Matangi? Or leave it alone, doctor. We all need that identity, right? Something called just me, right? So every time I start, I tell, I talk, I emphasize, and I finish my talk with only one thing. I am here, or whatever we are talking here, the awareness we are trying to create, all these things are trying to emphasize you ladies out of one small social stigma. Please think about yourself. The most important person of women health is most important thing is we don't give importance to this concept called me. Every time anything happens in your life, you always say give importance to something else, somebody else, or some occasion, everything. You don't even say that no. I have to go today, you make your dabba. Have you ever told anybody else? No. I have to make them dabba and then probably I may skip my breakfast, but probably make them dabba and give. Right? And they take us for granted. And I run and rush and go and take the bus. I don't say I have to leave early, I have to take my bus. No, I will run and take my bus, but I have to finish the work and go. So it is not that others are not giving importance to us. It is we not giving importance to ourselves. When am I going to say I am important? My breakfast is important. My timing is important. My schedule. And I need some me time. Yesterday evening I told, I have shut down all my calls. Somebody said, are you upset with me? I just wanted some me time. I just wanted to sit alone. Is it wrong? Yeah, I have to. That is the culture. That doesn't mean that I'm ignoring somebody, I'm disrespecting somebody, or I'm just like too arrogant or no, not like that. I'm very simple. I just need some half an hour for myself. Simple, period. After that, I'm available for you 24/7. No problem at all. So similarly, how we are going to do this meeting, very, very important in all our slides. Okay, second point, she introduced me as a radiation oncologist. So basically, cancer treatment has surgery, chemotherapy, and radiation. I'm the last person. Everywhere you go, anybody cannot do anything, they'll push it on my head. Okay? And whatever they have to do, not done, everything will be corrected, compensated, compromised, everything by radiation oncology. So I'm a very last person. Okay? Then why this radiation? Usually a surgeon will be called. Everywhere you see, you will be surgeons will be called and talked and everything. But here, why did I come out of my cabin? I thought awareness is very, very important because the same thing, all condemned people come to me. I have seen the worst part of the life. I've seen the worst part of all treatments. So I will start with, probably I may not start with the good news, but I start with a very, very small story which has affected me and pushed me out of my limits to come and stand in every college leaving my OPD. There was a 65-year-old lady. She is living with her only son and a daughter-in-law and grandchildren, right? One day, the family felt the house is bad smelling. Very bad smelling, rotten smell. Rotten smell andre or ಎಲ್ಲಿ ಸತ್ತೋಗಿರೋ smell. How many of you know that smell? Is it? You have lived with rats, is it? Good. Nice. So the rotten smell was so bad, they were finding out everywhere, ಇಲ್ಲಿದ್ಯಾ, ಹಳೆ ಊಟ ಇದೆಯಾ, ಇಲ್ಲ ಅವಳು ಅಡುಗೆ ಮಾಡಿರೋ ತಪ್ಪಾಯ್ತಾ. How many of you understand Kannada? All of you. Oh, no, my joke should not go waste, right? Because you're not laughing, or probably you're just like, yeah. So they have found out almost each and every corner of the house, but they could not find the source of the smell. Ultimately, the son found out when the mother comes and sits next to him, they get that bad smell. So ultimately, they push her into the room, try to remove her blouse, and see that there is a big cauliflower bleeding, filled with maggots, lesion, instead of one big or small muskmelon is sitting in front of the place of her breast. What is the situation? She had a lump in the breast, but she is a widow. She doesn't have a husband to tell that I have a lump in the breast. It's very delicate, very embarrassing for a mother or anybody to tell somebody who is not very close enough in their gender relation to talk. She doesn't have a daughter to tell. She has only a son. How will she go to her son and tell, I have a lump in the breast? This is our problem. We have only created inhibitions, limitations. You should not do this. You should not do that. You should not be like this. You should not stand up like this. You should stand up like this. You should keep looking down. We have created so many stigmas that the lady was suffering. She had, but she was scared to tell whom. Not to the daughter-in-law, not to the grandchildren. Ultimately, it was progressing, and she was now embarrassed. Very, very, very ashamed to show that she had such a big mass. And she came, ultimately, you know, if there is such a big watermelon and bleeding tumor, she would have had all stage 4 disease. This could have been diagnosed if that son had little time for his mother and taken for a master health checkup after 50 years. Just one mammography, 1 year. Probably they would have diagnosed the lesion at the level of a groundnut or a peanut size, or even before microcalcification, stage 0. I could have done it. All of us take our parents for granted. I will tell you another story. This Monday, my uncle and aunt came from their hometown for some function. I just brought them randomly for master health checkup. I do that. That is my habit. Anybody comes from hometown, I'll take them for master health checkup. Believe me or not, my uncle had a PSA raise. Being a cancer doctor, I was even optimistic. PSA just 14. Anyway, I'll get it tested because I know I should not ignore it. Got an MRI done. There was a lesion in the prostate. Yesterday, I got the biopsy done. So from Monday to Friday, already MRI is done, PSA is done, PSMA PET is done, biopsy is done, and I know he has stage 3 prostate cancer. He has no symptoms. But in India, most of them comes from the next stage. If I had not done this today, he would have gone home and it would have spread everywhere and he would have had a back pain. With the back pain, he would have come to me, and that time it is stage 4. He is just 57 years. He is just 5 years older than me. I'm like surprised. But I did my job. He came, I caught him. Now I can cure him. Now what about the cure? Now coming to this, madam, what is cure? Are you really saying? I remember one of the teachers, when I crossed, correct me, sorry ma'am for quoting this, I don't know the person, but this is what we encounter each and every person I'm going to hereafter see every day, right? When I'm going to travel, when I was just coming down the stairs, they said, madam, there's a talk about cancer, bartira. ಆ ವರ್ಡ್ ಕಂಡ್ರೇನೆ ನನಗೆ ಆಗಲ್ಲ, ಟೆನ್ಷನ್ ಆಗಿಬಿಡುತ್ತೆ. ನಾನು ಬರಲ್ಲಪ್ಪ. ಅದಕ್ಕೆ ನಾನು ಏನು ಟಾಪಿಕ್ ಹಾಕಿದೆ, ಹೆಲ್ತ್ನ ಹಾಕಿದೆ ಮೇಡಮ್, ನಾನು ಕ್ಯಾನ್ಸರ್ನೇ ಹಾಕಿಲ್ಲ. ನೀವು ಯಾಕೆ ಕ್ಯಾನ್ಸರ್ ಪ್ರಮೋಷನ್ ಮಾಡ್ತಾ ಇದ್ದೀರಾ? ನಾನು ಕ್ಯಾನ್ಸರ್ ಬರಬಾರ್ದು ಅಂತ ಹೇಳ್ತಾ ಇದ್ದೀನಿ, ನೀವು ಕ್ಯಾನ್ಸರ್ ಬಂದುಬಿಟ್ಟಿದ್ದೀರಾ ಅಂತ ಅಂದ್ಕೊಂಡು ಬರ್ತಾ ಇಲ್ಲ. ಇದಕ್ಕೆ ಅಟೆಂಡ್ ಮಾಡಿದ್ರೆ ತಾನೇ ಅದು ಬರಲ್ಲ, ಇದಕ್ಕೆ ಅಟೆಂಡ್ ಮಾಡಿಲ್ಲ ಅಂದರೆ ಅದು ಬರುತ್ತೆ. ಎಸ್, ಕರೆಕ್ಟ್ ಮೀ ಇಫ್ ಐ ಆಮ್ ರಾಂಗ್, ರೈಟ್? ಎಸ್ ಗರ್ಲ್ಸ್? Cool. So now we are going to talk how do we preserve our health, how to stay healthy, and how to detect it early that I am talking really about cure. Cure means, what is cure? ನಾಳೆ ನನಗೆ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಬರ್ಬೋದು, ಅದು ಕ್ಯೂರ್ ಅಲ್ಲ ತಾನೆ. So what is that? I have been detected from the disease, so I am going to live for next 5 years, 10 years, 20 years, 30 years. That is what is cure. Which means like forever eternity ನನಗೆ ಸೋಮವಾರ ಕೊಡಲ್ಲ ಯಾರು. ಅಮೃತಪಾನ ಯಾರಾದರೂ ಕೊಡ್ತಾರಾ? ಹೆಲ್ತ್ ಇದೆ, ನೀವು ಇದು ಕುಡಿದ್ಬಿಟ್ರೆ ಏನು ಬರಲ್ಲ ಅನ್ನೋ. ಇಸ್ ದೇರ್ ಎನಿ ಡ್ರಗ್ ಲೈಕ್ ದಟ್, ಪೋಷನ್ ಲೈಕ್ ದಟ್? ನೋ. ವಿ ಹ್ಯಾವ್ ಟು ಜಸ್ಟ್ ಕೀಪ್ ಅವರ್ ಸೆಲ್ಸ್ ಹೆಲ್ದಿ. ಸೊ ನಾವು ವಾಟ್ ಈಸ್ ಕ್ಯೂರ್ ಐ ವಿಲ್ ಟೆಲ್ ಯು. ಓಕೆ, ಯು ವಿಲ್ ಟೆಲ್ ಮೀ ಹೌ ಟು ಗೆಟ್ ಕ್ಯೂರ್. ಐ ವಿಲ್ ಟೆಲ್ ಯು ವಾಟ್ ಈಸ್ ಕ್ಯೂರ್, ಯು ಹ್ಯಾವ್ ಟು ಟೆಲ್ ಮೀ ಹೌ ಟು ಗೆಟ್ ಕ್ಯೂರ್. ಶಾಲ್ ವಿ ಸ್ಟಾರ್ಟ್ ದ ಗೇಮ್? ಯಾ. ಸೊ ದೆರ್ ಇಸ್ ಅ ಸ್ಮಾಲ್, ಎಷ್ಟು ಜನಕ್ಕೆ ಗಾರ್ಡನಿಂಗ್ ಇಷ್ಟ ಇಲ್ಲಿ? ನಾನು ಮಾಡ್ತೀನಿ, ಮನಿ ಪ್ಲಾಂಟ್ ಇಡ್ತೀನಿ. ಓಕೆ, ಯಾ, ಥ್ಯಾಂಕ್ ಯು. ಸೊ ನಾನು ಒಂದು ಮನಿ ಪ್ಲಾಂಟ್ ಇಟ್ಟೆ, ಸರಿನಾ? ನನ್ನ ರೂಮಲ್ಲಿ, ಕ್ಯಾಬಿನಲ್ಲಿ ಚೆನ್ನಾಗಿರಬೇಕು, ಎಲ್ರಿಗೂ ದುಡ್ಡು ಬರಬೇಕಂದ್ರೆ ಒಂದು ಮನಿ ಪ್ಲಾಂಟ್ ಇಡಬೇಕು, ಬ್ಯಾಂಬೂ ಪ್ಲಾಂಟ್ ಇಡಬೇಕು. ಬ್ಯಾಂಬೂ ಪ್ಲಾಂಟ್, ಮನಿ ಪ್ಲಾಂಟ್ ಇಟ್ಟರೆ ದುಡ್ಡು ಬರುತ್ತೆ ಅಂದರೆ ಇಟ್ಸ್ ಓಕೆ, ಫೈನ್. ಆ್ಯಂಡ್ ಇನ್ನೊಬ್ಬರೇ ಗಿಫ್ಟ್ ಮಾಡಬೇಕು, ಅದು ನಾವಾಗಿ ತೊಗೋಬಾರ್ದು, ಅದು ಬೇರೆ. ವಾಟ್ ಆಲ್ ನೈಸ್ ಐಡಿಯಾಸ್, ರೈಟ್? ಸೊ ಐ ಆಲ್ಸೋ ಕೆಪ್ಟ್ ಒನ್ ಮನಿ ಪ್ಲಾಂಟ್, ರೈಟ್? ದರ್ ವಾಸ್ ಒನ್ ಸ್ಮಾಲ್ ಗ್ರಾಸ್ ಗ್ರೋಯಿಂಗ್ ದೇರ್. ಓಕೆ, ಇಟ್ ಈಸ್ ನೌ ಜಸ್ಟ್ ಓನ್ಲಿ 2 leaves. But I know how to water the plant. But I'm too busy. ಆ ಎಲೆ ತೆಗೆದಿರ್ಬೋದಾ ನಾನು? ಆ ಕಳೆನೋ ತೆಗೆದಿರ್ಬೋದಾ? ತೆಗಿಬೇಕಾ ತೆಗಿಬಾರ್ದಾ? ಬಟ್ ನಾನು ಬ್ಯುಸಿ ಅಲ್ವಾ? ಐ ಆಮ್ ಆಲ್ವೇಸ್ ಬ್ಯುಸಿ. 24/7 ನನಗೆ ಸಾಕಾಗಿಲ್ಲ. ಬೆಳಗ್ಗೆ ಎದ್ದೊಳ್ಳಿ ಕೆಲಸ ಮಾಡಿ, ಓ ಮೈ ಗಾಡ್, ಐ ಡೋಂಟ್ ಹ್ಯಾವ್ ಟೈಮ್. ಸೊ ನಾನು ಏನು ಮಾಡ್ತೀನಿ, ಇದು ನಾಳೆ ಮಾಡೋಣ. ಬಟ್ ಐ ಆಮ್ ಲಿಟಲ್ ಬ್ರಿಲಿಯಂಟ್, ಲಿಟಲ್ ಇಂಟೆಲಿಜೆಂಟ್, ನೈಸ್ ಪರ್ಸನ್. ಸೊ ಟುಡೇ ಓನ್ಲಿ ರಿಮೂವ್ ಇಟ್. ತೆಗಿಯೋಕ್ಕಾಗತ್ತಾ? ಬರುತ್ತಾ? ನಾನು ಹೇಳಿದೆ, ಇಫ್ ಯು ಆರ್ ನಾಟ್ ರೆಸ್ಪಾಂಡಿಂಗ್ ಐ ವಿಲ್ ಕಾಲ್ 3 times. I probably worked in court or something. Girls, that's a joke. Cool, thank you. So I removed the plant. ಇವಾಗ ಆ ಪ್ಲಾಂಟ್ ತೆಗೆಯೋದಕ್ಕೆ ಆರಾಮಾಗಿ ಬಂತು. ಅಲ್ಲಿ ಬೇರ್ಗಳು ಸಮೇತ ಬಂತಾ? Could I remove it with the full roots? Yes, which means you don't have a plant. So it's only 2-leaf stage and there is only a small tender root. It is very easy for me to remove it. I've taken it out. Now have the seeds been produced in the plant? Illa. Innu bere estondu bandide. So obviously seeds innu utpatti agilla. Do you agree with me? Yes. So I am an intelligent person, smart person, very good person. I removed it the moment I saw it. So who is intelligent? The person who gives attention and faces the problem immediately and not postponing things. Cool? Yes. First solution. Second solution. I am little less intelligent, less smart, less attentive. So I ignore the weed. I only pour water for the plant. I am only bothered about the plant. I am not bothered about the weed. Now the weed has grown like this. Now I am trying, for one fine day I am going like, I have time too much today, Saturday, weekend. No, weekend we have to do something. So we'll always do gardening. Gardening is for what? Doing something on the weekend. That is our hobby, right? So I go there and now try to pull it out. Is it easy to remove? Why? Very difficult because it ದೊಡ್ಡದಾಗ್ಬಿಟ್ಟಿದೆ. ಆದರೆ ತೆಗೆದ್ರೇನು ಏನು ಉಳಿದಿರುತ್ತೆ? What will be left out? Lot of roots will be left out. Can it come back there? ಇದಕ್ಕೆ ನಿದ್ರೆ ಮಾಡಬಾರ್ದು. ಕಾಫಿ ಕೊಡ್ತೀನಿ, ನೋ ಪ್ರಾಬ್ಲಮ್. ಓಕೆ, ತೆಗೆದ್ರೆ ಬರುತ್ತಾ ಬರಲ್ಲ? ಬಂದ್ಬಿಟ್ಟಿದೆ, ಹೇಗೋ ಬಂದ್ಬಿಟ್ಟಿದೆ, ಬಟ್ ಪೂರ್ತಿಯಾಗಿ ಬಂದಿಲ್ಲ, ಬೇರ್ಗಳು ಸಮೇತ ಬಂದಿಲ್ಲ, ಬೇರ್ಗಳು ಉಳ್ತಿದೆ. ದೇರ್ ಆರ್ ಲಾಟ್ ಆಫ್ ರೂಟ್ಸ್ ಲೆಫ್ಟ್ ಔಟ್. ಸೊ ಇಟ್ ಈಸ್ ಗೋಯಿಂಗ್ ಟು ಕಮ್ ಬ್ಯಾಕ್ ಫ್ರಮ್ ದ ರೂಟ್ಸ್ ಆರ್ ನಾಟ್? ಎಸ್. ಇವಾಗ ಇಷ್ಟು ದೊಡ್ಡದಾಗಿದೆ, ಬೀಜಗಳು ಉತ್ಪತ್ತಿ ಆಗಿರುತ್ತಾ ಇಲ್ವಾ? ಎಸ್. ಬೀಜಗಳೆಲ್ಲ, ಮಣ್ಣೆಲ್ಲ ಕೆಟ್ಟೋಗಿರುತ್ತಾ ಇರಲ್ವಾ? ಆ ಬೀಜಗಳಿಂದ ಕಳೆ ಬರುತ್ತಾ ಬರಲ್ವಾ? ಎಕ್ಸಾಕ್ಟ್ಲಿ ಮೈ ಪಾಯಿಂಟ್. ಸೊ ನೀವೇ ಕ್ಯೂರ್ ಇದೆಯಾ ಇಲ್ವಾ? ಪುನಃ ಬರುತ್ತಾ ಬರಲ್ವಾ? ಸೊ ನಾನು ತೆಗ್ಬಿಟ್ಟಿದ್ದೀನಿ, ಬೇರ್ಗಳನ್ನ ಏನೇನೋ ಮಾಡಿ ಅದು ಇದನ್ನು ಮಾಡಿ ಎಲ್ಲ ಮಾಡ್ತೀನಿ, ಆದರೆ ನಿಮಗೆ ಗೊತ್ತು ಅದರಿಂದ ವಾಪಸ್ ಬರೋದಕ್ಕೆ ಚಾನ್ಸಸ್ ಇದೆ. ಕರೆಕ್ಟ್ನಾ? ನಾನು ಇನ್ನೂ ಸೂಪರ್ ಇಂಟೆಲಿಜೆಂಟ್, ಸೂಪರ್ ಹಾರ್ಡ್ ವರ್ಕಿಂಗ್. ನನಗೆ ವೀಕೆಂಡೇ ಸಾಕಾಗಿಲ್ಲ, ಸಮ್ಮರ್ ವೆಕೇಷನ್ಗೋಸ್ಕರ ಕಾಯ್ತಾ ಇದ್ದೀನಿ. ಸಮ್ಮರ್ ವೆಕೇಷನಲ್ಲಿ ಹೋಗಿ ಕಳೆನೋ ತೆಗಿಯೋಣ ನಾನು ಅಂದ್ಕೊಂಡೆ. ಅಲ್ಲಿ ಹೋಗಿ ನೋಡಿದ್ರೆ ಮನಿ ಪ್ಲಾಂಟೇ ಇಲ್ಲ, ಬರೀ ಆ ಕಳೆಗಳು ಒಂದು ಸಿಕ್ಕಾಬಟ್ಟೆ, ಒಂದಿರೋದು ಇವಾಗ 10 ಇದೆ. ನೌ ಯು ಟೆಲ್ ಮೀ, ನಾನು ಆ ಮನಿ ಪ್ಲಾಂಟ್ನ ಬದುಕ್ಸಕ್ಕೆ ಆಗುತ್ತಾ ಆಗಲ್ವಾ? ಕ್ಯಾನ್ ಐ ಸೇವ್ ದ ಮನಿ ಪ್ಲಾಂಟ್? ದೆರ್ ಇಸ್ ನೋ ಮನಿ ಪ್ಲಾಂಟ್. ಸೊ that is how you tell about cancer stages. So when it is 2 leaves, peanut size or even smaller, it is stage 1. So it is not left out roots, there are no seeds produced. ಸರ್ಜರಿ ಮಾಡಿ ತೆಗೆದುಬಿಟ್ಟೆ, ಇವಾಗ ಬೇರ್ಗಳು ಉಳಿದಿಲ್ಲ, ಬೀಜಗಳು ಹರಡಿಲ್ಲ, ಕ್ಯೂರ್ ರೇಟ್ ಎಷ್ಟಿದೆ? ಪುನಃ ಬರುತ್ತಾ? ಸೊ ಐ ಆಮ್ ಟೆಲ್ಲಿಂಗ್ ಯು 90 to 95% ನೆಕ್ಸ್ಟ್ 10 years ಬರಲ್ಲ. ಎಸ್ ಮೇಡಮ್? ಎಸ್. ಅದೇ 3 ವಾರ ಆದಮೇಲೆ ಬೇರ್ಗಳು ಉಳಿದಿದೆ, ಕಷ್ಟಪಟ್ಟು ತೆಗೆದುಬಿಟ್ಟೆ, ಬೇರ್ಗಳು ಉಳಿದಿದೆ, ಬೀಜಗಳು ಹರಡ್ಬಿಟ್ಟಿದೆ, ದಟ್ ಇಸ್ ಸ್ಟೇಜ್ 3. Now I have to give you radiation after the surgery, radiation to address the roots, chemotherapy to go in the blood and kill all the seeds possible everywhere. But I do not know whether this chemotherapy has gone and killed everything. Then you have to give exam every year. Test ಮಾಡಿಬಿಟ್ಟು ವಾಪಸ್ ಬಂದಿಲ್ಲ ತಾನೆ 50-50. ಯಾವಾಗ cat on the wall? Who made the cats to sit on the wall? Me. Right? So when stage 3, when the doctor says it has come down to 50% chance of cure, ಅದು ಯಾಕೆ? Because I was little less attentive. Did the doctor change anything? Did the science change anything? Can research do anything better? Even I've put crores and crores. If you're sitting at home, I cannot pull you for a treatment. Now coming back to the last thing. I'm going on a summer vacation. I will keep summer vacation only to go for my master health checkup, or any complaints I will go only during summer vacation or during my vacation when my principal gives me leave. ಅವ್ರು ಕೊಟ್ಟಿಲ್ಲ ಅವ್ರ ಹೆಸರು ಹೇಳ್ಬಿಟ್ಟು ನಾನು ಹೋಗಲ್ಲ. ಮೇಡಮ್ ಶಕ್ತಿಲ್ಲ ಮೇಡಮ್ ಯಾರ ಹೇಳಿದ್ರೆ ನನಗೆ ಹೇಳ್ಬಿಡಿ, ಓಕೆನಾ? ಸೊ ಹಾಗಾಗಿ ಅಷ್ಟು ಟೈಮ್ ಇಟ್ಕೊಂಡು ನಾನು ಹೋದರೆ ಪೂರ್ತಿ ಶರೀರಾಗೆ ಹರಡ್ಬಿಟ್ಟಿದೆ, ಸ್ಟೇಜ್ 4. Now you please tell the doctor, please do something. This is one dialogue I hate in my life. And everywhere you have disease. ನಿಧಾನ ಅಷ್ಟೊಂದು ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿನ ಆದಮೇಲೆ ಯು ಕೀಪ್ ಯುವರ್ ಫೇಸ್ ಸೊ ಇನ್ನಸೆಂಟ್ ಅಂದರೆ ಆಸ್ಕ್ ಮಿ, ಜೀವಕ್ಕೇನು ಅಪಾಯ ಇಲ್ಲ ತಾನೆ? I keep my face like this. What should I tell now? How should I keep my face? Should I also keep innocent and see, let's see? That is the safest way, right? You also act innocent, I also act innocent. God will anyway tell you over the period of time what is going to happen to you, right? Acting innocent is very easy. You are out of many troubles, okay? So the concept of today's talk is the most important thing. I'm going to start everything, but this talk is useless if you don't understand the concepts. Give importance to yourself, give time for yourself, give attention to yourself, and when your body is calling, please listen to it. And go, and nobody is saying that but just because you have entered a hospital, you go, no, now you have become cancerous. Because you've entered my OPD, I'm going to tag you as a cancer. No. 90% of the lumps are non-cancerous. 90% of the complaints are non-cancerous. But we do not know who is cancerous, and I also cannot certify. I'm not like outside, oh, I have seen you, you are non-cancerous, okay, you can go. I cannot do that, right? So somebody has to do some tests, relevant investigations, and say that, okay, Baba, you are not having anything, just have a regular follow. But you had some complaints, that is why you're going to a doctor. I'm not saying you didn't have complaints, you're not going to doctor. So now coming back to the health. We are only going to talk about health. What is health? ಇವಾಗ ಉಲ್ಟಾ ಅಲ್ವಾ? ಡಿಸೀಸ್ ಅಂದರೆ ಏನೋ ಆಬ್ಸೆನ್ಸ್ ಆಫ್ ಹೆಲ್ತ್, ಹೆಲ್ತ್ ಅಂದರೆ ಆಬ್ಸೆನ್ಸ್ ಆಫ್ ಡಿಸೀಸ್. ಕೂಲ್ ರೈಟ್? ಈ ಥರ ಕೇಳಿದ್ರೆ ಆ ಕಡೆ ಹೇಳಿದೆ, ವಾಟ್ ಎವರ್ ಇಟ್ ಇಸ್. ಆರ್ ಯು ಆಲ್ ಹೆಲ್ದಿ? ಹೌ ಡು ಯು ನೋ? Okay, now I'm going to put the pictures. You're going to tell me whether we are healthy, right? Coming next slide. The point of crowded slide. I generally don't put more than 2 or 3 points in a slide, but I put too many points to tell on the left side is longer queue, rather than the right side cube. Okay? Why? What is right, left side? Modifiable. Simple. Take a measure, none kailallide. It's not that ನನಗೆ ಯಾಕೆ ಕ್ಯಾನ್ಸರ್ ಬಂತು ಗೊತ್ತಿಲ್ಲ ಮೇಡಮ್, ಅದಿಲ್ಲ. ಇದೆಲ್ಲ ನಾವು ನೋಡಿಲ್ಲ. ಅದಕ್ಕೆ ಇವಾಗ ನಾನ್ ಮಾಡಿಫೈಯಬಲ್. ನನಗೆ ವಯಸ್ಸಾಗ್ಬಿಟ್ಟಿದೆ, ಕ್ಯಾನ್ಸರ್ ಬಂದಿದೆ. ಐ ಕ್ಯಾನ್ ನಾಟ್ ಆಲ್ವೇಸ್ ಸ್ಟೇ ಯಂಗ್. ಜೆಂಡರ್, ನಾನು ಲೇಡಿ ಆಗಿರೋದ್ರಿಂದ ನನಗೆ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಬಂದಿದೆ. ಜೆಂಟ್ಸ್ಗೂ ಬರುತ್ತೆ, ಬಟ್ ದಟ್ಸ್ ಓನ್ಲಿ 1%. ಬಟ್ ಲೇಡೀಸ್ ಆಗಿರೋದ್ರಿಂದ ಅದು ನನ್ನ ತಪ್ಪಾ? So it is non-modifiable. Okay, just because I am a lady, I have breast, I get breast cancer. ನಾನು ಗರ್ಭಕೋಶ ಇದೆ, ಗರ್ಭಕೋಶ ಕ್ಯಾನ್ಸರ್ ಬಂದಿದೆ, ಅದು ದಟ್ ಈಸ್ ನಾನ್ ಮಾಡಿಫೈಬಲ್. ಥರ್ಡ್ ಥಿಂಗ್, ಮೆನಾರ್ಕಿ ಆ್ಯಂಡ್ ಮೆನೋಪಾಸ್. ತುಂಬ ಬೇಗ, ಐ ಆಮ್ ಓನ್ಲಿ ಟಾಕಿಂಗ್ ಅಬೌಟ್ ನಾನ್ ಮಾಡಿಫೈಬಲ್. ನನ್ನ ಕೈಯಲ್ಲಿ ಏನೂ ಆಗಲ್ಲ ಅನ್ಕೊಳ್ತಾ ಇರೋದು, ಬಟ್ ದೇರ್ ಆರ್ ಸ್ಟಿಲ್ ಮಾಡಿಫೈಬಲ್, ದೇ ಆರ್ ಸ್ಟಿಲ್ ಓಕೆ. ಮೆನಾರ್ಕಿ ನನಗೆ ಬೇಗ ಬಂದುಬಿಟ್ಟಿದೆ ನನ್ನ ಮಕ್ಕಳಿಗೆ. ಪ್ರೀವಿಯಸ್ಲಿ ಇನ್ ಮೈ ಡೇಸ್ ಅಟ್ ಲೀಸ್ಟ್ ಇಟ್ ವಾಸ್ ಲೈಕ್ 13 years, 14 years. Suddenly it became 11 years. Now it is 8 years. I'm like, that child is not even knowing how to keep a sanitary pad and she's already started having periods. And people are having still 55 years, 58 years. Nan thai kaladalla 40, 45 years, 48 years. Average Indian age was 48 when they attained menopause. Now it is going on 50, 55 like Western countries. Okay, so is it modifiable or non-modifiable? Everything ನಾನು ಏನು ಮಾಡಿದ್ದೀನಿ ಮೇಡಮ್, ನಾನು ಏನು ಮಾಡಿಲ್ಲ. ಎಸ್, ನೀವೇನು ಮಾಡಿಲ್ಲ. The problem is, nowadays, girl children don't go out of the house. ಹಳೆ ಕಾಲದಲ್ಲಿ ಹೋಗಬಾರ್ದು, ಇವಾಗ ನಾವು ಹೋಗಲ್ಲ. ಓಕೆ, ಏನು ಮಾಡಬೇಕು? ಕಪ್ಪಾಗ್ಬಿಡ್ತೀವಿ, ಬಿಸಿಲಲ್ಲಿ ಹೋಗಬಾರ್ದು. ಹೋದರೆ ಟೆರರಿಸ್ಟ್ ಥರ ಹೋಗಬೇಕು, ಎಲ್ಲ ಕಡೆನೂ ಮುಚ್ಚಿಟ್ಟು, ಅಯ್ಯೋ ಬೆರಳೆಲ್ಲ ಕಾಣಿಸ್ತಾ ಇದೆ. ಆ್ಯಂಡ್ ನೈಲ್ಸ್ ಬ್ರೇಕ್ ಆಗಬಾರ್ದು, ಅದೆಲ್ಲ ಬೇರೆ. ಆಲ್ ದೀಸ್ ಥಿಂಗ್ಸ್ ವಿಲ್ ನಾಟ್ ಬ್ರೇಕ್ ಇಫ್ ಯು ಆರ್ ಗೋಯಿಂಗ್ ಇನ್ ಸನ್ಲೈಟ್. ಆಬ್ವಿಯಸ್ಲಿ ಯು ನೀಡ್ ನಾಟ್ ಒನ್ ಪ್ರೊಟೆಕ್ಟ್ ವಿತ್ ಆರ್ಟಿಫಿಷಿಯಲ್ ಥಿಂಗ್ಸ್. ಸೊ ಚಿಕ್ಕ ವಯಸ್ಸಲ್ಲಿ PT ಪೀರಿಯಡ್ ಒಂದಿರುತ್ತೆ, 4 to 6, 5:30 ಆಟ ಆಡಬೇಕು. ಎಷ್ಟು ಜನ, ಹೌ ಮೆನಿ ಆಫ್ ಯು ಆರ್ ಎಕ್ಸ್ಪರ್ಟ್ ಇನ್ ಗೇಮ್ಸ್? 1%, 2%, 3%, 4%, 5%. ಸುಮ್ಮನೆ ಇರಿ, ಕ್ಯಾರಮ್ ಬೋರ್ಡ್, ಚೆಸ್ ಎಲ್ಲ ಹೇಳ್ಬೇಡ, ಇಡಿ. ಫಸ್ಟು ಒಬ್ರಿದು, ದೆನ್ ಎವ್ರಿಬಡಿ ಇಸ್ ರೈಸಿಂಗ್. ಐ ಆಲ್ಸೋ ಡೂ ಮೊಬೈಲ್ ಗೇಮ್ಸ್. ನಾವು ಮೊಬೈಲ್ ಗೇಮ್ಸ್ ಎಲ್ಲ ನಾಟ್ ಇನ್ಕ್ಲೂಡೆಡ್. ಓಕೆ, PT ಪೀರಿಯಡ್ ಸಂಜೆ 4 ಗಂಟೆಯಿಂದ 5 ಗಂಟೆ ಯಾರು ಗ್ರೌಂಡಿಗೆ ಹೋಗಿ ಆಟ ಆಡ್ತೀರಾ? ರೈಸ್ ಯೋರ್ ಹ್ಯಾಂಡ್ಸ್. ಟೈಮ್ ಇಲ್ಲ ಮೇಡಮ್. ಟೈಮ್ ಇದ್ದರೆ ಮಾತ್ರ ನೀವೆಲ್ಲ ಇಲ್ಲ. ಲೆಟ್ ಮಿ ಸಿ, ವಿ ವಿಲ್ ನೌ ಟಾಕ್ ಟು ಶಕುಂತಲಾ ಮ್ಯಾಮ್. ವೇರ್ ಇಸ್ ದ ಟೈಮ್ ಮ್ಯಾಮ್? ನೋಡೋಣ ಮ್ಯಾಮ್, ಯಾರ್ಯಾರೆಲ್ಲ ಎನ್ಲಿಸ್ಟ್ ಮಾಡ್ತಾರೆ. ಸೊ ದ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್ ಈಸ್ ದಟ್ ಪೀರಿಯಡ್ ವೇರ್ ಯು ಆರ್ ಪ್ಲೇಯಿಂಗ್ ಅರೌಂಡ್. ಎಷ್ಟು ಫಿಸಿಕಲ್ ಆ್ಯಕ್ಟಿವಿಟಿ, ಎಷ್ಟು ಓಡಾಡ್ತಾ ಇರ್ತೀರಾ. ವೈ ಅಟ್ ದ್ಯಾಟ್ ಏಜ್ ಮೆನಾರ್ಕಿ ಈಸ್ ಇಂಪಾರ್ಟೆಂಟ್? ದಟ್ ಈಸ್ ದ ಟೈಮ್ ವೆನ್ ಯುವರ್ ಬ್ರೆಸ್ಟ್ ಇಸ್ ಗೆಟಿಂಗ್ ಡೆವಲಪ್ಡ್. ಬ್ರೆಸ್ಟ್ ಎಲ್ಲ ಡೆವಲಪ್ ಆಗಿನ ಆದಮೇಲೆ ಯು ಮೇಕ್ ಎವ್ರಿಥಿಂಗ್, ಅಗೇನ್ ಥಿಂಗ್ಸ್ ಗೋ ರಾಂಗ್. The most important thing is, yake menarche, you sit in a sofa, watch TV, always with a lace, kurkure, bingo, mad angles, turn ಮಾಡಿ, ಅದು ಹೇಳೋಕ್ಕಾಗಲ್ಲ, ಹಲೋ ಹೇಳೋಕ್ಕಾಗಲ್ಲ. All these things will be. How many of you like these things? See, now 95%. I know. So that is the reason for getting your periods earlier, getting your problems with your periods, getting your periods later. Physical activity illa, couch potato agirtivi, and junk food, and muddu pillappa. You should be like buns, bubbly. That baby, if they sit, it will be like one toy. What? The baby should be thin, active, intelligent, not like I also sit, you also. Everybody comes and pinches the cheek. No, that's very wrong. Family history, I cannot change family history, but family histories is not necessarily genetic. There are two differences. All the sisters grow together in the same similar habits, similar food habits, and similar radiation exposure area. All those things may result in cancerous thing. For example, higher incidence of cancer in Kerala because there is a terrestrial radiation is very high. In Kolar, terrestrial, you know that mine, ground, because the underground radiation is very high. So you will have a lot of patients coming from cancer in these areas where terrestrial radiation is very, very high. These are all I cannot change, right? Because I've grown up in that area and my gene has got. And second thing is genetics. Iva thaige bandre magalge barutta. That is one question, right? So if that is happening, every mother's child will immediately 30 years agbitre band admit agtare. Not like that. Okay? So I should have 3 first degree blood relatives. Andre ನನಗೆ ಬಂತು, ನನ್ನ ಜೊತೆ ಹುಟ್ಟಿರೋರು, ದಟ್ ಇಸ್ ಫಸ್ಟ್ ಡಿಗ್ರಿ, ಕ್ಲೋಸ್ ಡಿಗ್ರೀಸ್. ನನ್ನ ಜೊತೆ ಹುಟ್ಟಿರೋರು, ಇಲ್ಲಾಂದರೆ ನನ್ನ ತಾಯಿ, ಅರ್ಥ ಆಯ್ತಾ? ನನ್ನ ತಾಯಿ, ಚಿಕ್ಕಮ್ಮ, ಮೈ ಬ್ಲಡ್ ರಿಲೇಟಿವ್ಸ್, ನಾಟ್ ಮೈ ಚಿಕ್ಕಪ್ಪ's wife ಚಿಕ್ಕಮ್ಮ. She is not related blood to me, right? In a blood way, is she related? No, okay, you are still awake. Good. Somebody was yawning there, that's why I asked questions. Okay. So, ನನ್ನ ಫಸ್ಟ್ ಡಿಗ್ರಿ ರಿಲೇಟಿವ್ಸ್ ನನ್ನ ಜೊತೆ ಹುಟ್ಟಿರೋರು, ನನ್ನ ತಾಯಿ ಜೊತೆ ಹುಟ್ಟಿರೋರು, ಇಲ್ಲಾಂದರೆ ನನ್ನ ತಂದೆ ಜೊತೆ ಹುಟ್ಟಿರೋರು, ಆರ್ ದ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್, men having cancers is also very, very important, especially male breast cancer. 99% is genetic. You know Serena Williams? How many of you know? Yeah. And what is the other person's name? Venus Williams, right? Both their father had breast cancer. So he was BRCA2 positive. So that's why Serena Williams and Venus Williams now are at 90% risk of developing a breast cancer. So male breast cancer is very, 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 very deadly. Nobody talks about it, and men never attend the talks. We always say, you go out, you don't have business here. No, they don't have breast illa. They have breast, they don't have substance of the breast. So hagagi, if they develop a lump in the place, immediately adu hogi, it will get attached to the chest wall and the skin, and they will become very advanced stage faster than us. And additionally, they don't suspect they might get a cancer. This is very, very worsening part of these things. And additionally, we are ashamed to tell that a man had a breast cancer. Even more worse. Now, next question is, female ke breast cancer bandre, female surgeon hatra hogbodu. Men ge breast cancer bandre, yaar hatra hogbodu. This is another confusion they have. They still come to me, female surgeons to get breast cancer operated. Anybody can operate here. Okay. So, dense breast says, the breast volume, mammography ಮಾಡಿದ್ರೆ ಪೂರ್ತಿಯಾಗಿ ಬೆಳ್ಳಗಾಗಿರುತ್ತೆ, it will be white. This is all because of your too much of hormone exposure during all your childhood, during your breast development. That is where I'm going back again. Estrogen ಎಲ್ಲಿಂದ ಬಂತು ಮಾತಾಡೋಣ, ಓಕೆನಾ? Same thing. Last is benign breast diseases. Not all lumps are cancerous. Not all benign breast disease. ನನಗೆ ಒಂದು ಗಂಟು ಇತ್ತು, ನಾಳೆ ಅದು ಕ್ಯಾನ್ಸರ್ ಆಗುತ್ತೆ, ಇಲ್ಲ. Fibroadenoma will not become a cancer. Fibrocystic disease will not become a cancer. ಅದರಲ್ಲಿ ಬಯಾಪ್ಸಿ ಮಾಡಿದ್ರೆ ATP ಅನ್ನೋದು ಬರಬೇಕು. ಆ ಥರ ಇದ್ದರೆ they have a small chance of becoming. Why I'm saying this? Because ಎಲ್ರಿಗೂ ಗಂಟು ಇರ್ಬೋದು at the age of development, 14 years, 13 years, fibroadenoma ಇರ್ಬೋದು. Not necessarily you have to go and remove it because tomorrow ಇದು ಕ್ಯಾನ್ಸರ್ ಆಗ್ಬೋದು. Nothing like that. You need not remove it unless it becomes more than 5 centimeter or cosmetically it's failing. Don't go and do any surgeries. Last thing, any of the hormonal exposure during when the baby is in your so whatever the mother eats, whatever the mother does during pregnancy affects the children a lot. Okay, now coming to the what are the things we can do. Can we do something? Okay, we are doing already these things, right? So now the most important thing, now first coming to the first point, obesity andre eno nanu all these people are motivating me to run because all the time I'm sitting in my clinic, I'm not able to do physical activity. I'm going and telling everybody to do physical activity, but I'm not able to do it. I've started from the session that Indian Cancer Society. I'm still in 2 kilometers, 3 kilometers per day. I have to reach 10 kilometers one day, and probably by next talk, when I'm coming here, I would have reduced to my regular weighting. Okay? Thank you. Thanks for this motivation. So, what is obesity? Thank you. So, obesity is, how do I generally define? Okay, na BMI adala tumba mobile ittalla calculation ಮಾಡಬೇಡ. I do 160 centimeter if I'm a height, take off 100 centimeter and take off 2 kgs. That should be your maximum weight. Okay, so what is your weight? So if I'm 160 centimeter, what is my maximum weight permissible? 58. Okay, and this weight also, how is it distributed? So it is not for the sake of, like dumbbell shape, apple shape, V shape. These are all health indicators. It is not fashion indicators. This is health indicators. The circumference measurement you do at the level of shoulders. Okay, it should be equivalent to the circumference you do at the hip level. Okay, hip level is this place where you see both the bones on your side. Okay, that is hip level. But that should be, there is something in between that is called waist at the level of umbilicus. That should be lesser than these two. That is what it is called, dumbbell shaped. Okay, 36, 28, 36, 28, 30, I don't know, whatever it is. You define that, okay? But what happens over a period of time, whether it is man or woman, we become a cylinder. Obviously, don't see me from the sides or from the side. That is what we become. And there are two types of obesities for men or women. It is called pear-shaped obesities. Pear-shaped andre illi ಏನು ದಪ್ಪಕ್ಕಾಗಲ್ಲ. Our hands will become weaker and weaker. We don't do any work with the hands, and we always keep sitting on the chair. Chair-borne habits. Chair-borne habits ಅಲ್ಲಿ ಮನೆಯಲ್ಲಿ ಮಲ್ಕೊಂಡು ಆಮೇಲೆ ಸೋಫಾ ಅಲ್ಲಿ ಕೂತ್ಕೊಂಡು ದೆನ್ ಡೈನಿಂಗ್ ಟೇಬಲ್ ಅಲ್ಲಿ ಕೂತ್ಕೊಂಡು ಇದೆಲ್ಲ ಕಷ್ಟಪಟ್ಟು ಮಾಡ್ತಾ ಇದ್ದೀನಿ. Believe me, okay, with so much of difficulty. I lift my body and sit on the sofa, lift my body and go to the dining table, then come in two-wheeler, four-wheeler, six-wheeler, or whatever to the college or office or whatever it is. Come here, illi, nan seat illi. Where is your seat? Nobody wants to stand here, okay? ಓಡೋಡಿ ಹೋಗಿ ಕೂತ್ಕೊಂಡ್ಬಿಡ್ಬೇಕು. 8 hours ಕೂತ್ಕೊಂಡು ಪುನಃ ಅದೇ ಸೇಮ್ ಲೈನ್ ವಿಲ್ ಫಾಲೋ ಬ್ಯಾಕ್. We'll transport and then go back, sofa, couch and cot. Finished. How much are we bending down? How many of you every day bend down? ಬಗ್ಗೆ ಏನು ಮಾಡ್ತೀರಾ? ಪೆನ್ ತೊಗೊಂಡೇ ಹೇಳ್ಬಾರ್ದು. ಶೂ ಹಾಕೊಂಡ್ರಾ? ಬೆಂಡ್ ಮಾಡಿ. ಶೂ ಲೇಸಾ? ಅದನ್ನೂ ಇಲ್ಲ. ಅವಾಗ ಲೇಸ್ ಇಲ್ಲ ಆದ್ರೆ ಶೂ ತೊಗೊಳ್ದೆ. ಏನು ಮಾಡ್ತೀಯಮ್ಮ ನೀನು? ಇಷ್ಟು ಟೈಮ್ ಕೈ ಮೇಲೆ ಮಾಡಿದೆ. ಏನು ಮಾಡ್ತೀಯ ನೀನು ಕೈ ಬಗ್ಗೆ? ಬಿಕಾಸ್ ಐ ಫೀಲ್ ಮಾಪ್ ಸ್ಟಿಕ್ ಇಸ್ ಆಲ್ಸೋ ಲಾಂಗರ್. ನೋ ಬಡಿ ಬೆಂಡ್ಸ್ ನೌ ಡೇಸ್. ಮತ್ತೆ ಬಗ್ಗೆ ಏನು ಮಾಡಿದ್ಯಾ ಹೇಳಿಲ್ಲ ನೀನು ಇನ್ನೂ. ವಾಷಿಂಗ್ ಕ್ಲೋತ್ಸ್ ನಿಲ್ತ್ಕೊಂಡು ಬಗ್ಗೆ ಮಾಡಿದ್ಯಾ? ಕವಾನ್ ಯಾರ್, ನಾವು ಸ್ವಲ್ಪ ಮಾಡಿದ್ವಿ ಕೆಲಸ. ನಮಗೆ ಕೆಲಸ ಕೂತ್ಕೊಂಡು ಮಾಡಿದ್ಯಾ ನನಗೆ ಗೊತ್ತು. The point is we cannot bend and wash clothes. How many of you understand here? Accept it here. ಸ್ವಲ್ಪ stone, okay, I accept. If the stone is like halfway, you probably little bend. Okay, I agree with that. Okay, ನನ್ನ ಕಾಲದಲ್ಲೆಲ್ಲ ಮನೆ ಒರೆಸ್ಬೇಕಂದ್ರೆ you have to bend down, stand, bend down and mop the floor. You cannot sit and mop the floor or do a mop stick. ನನ್ನ ಅಜ್ಜಿ ನನ್ನ ಹೊಡಿತಾಳೆ. ಓಕೆ, ಹೌ ಮೆನಿ ಆಫ್ ಯು ಮಾಪ್ ದ ಫ್ಲೋರ್ ಲೈಕ್ ದ್ಯಾಟ್? ಬಟ್ಟೆ ಇಟ್ಕೊಂಡು ಮಾಪ್ ಸ್ಟಿಕ್. ನಾನು ಹೇಳಿದೆ ಅಲ್ವಾ ಕಡೆ ಮಾಪ್ ಸ್ಟಿಕ್ ಇಲ್ಲಿ ಬಂದ್ಬಿಟ್ಟಿದೆ. ಸೊ ದ ಪಾಯಿಂಟ್ ಇಸ್ ದ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ವೆಸ್ಟರ್ನ್ chair-borne habits has increased our weight distribution in the central area. ಅರ್ಥ ಆಯ್ತಮ್ಮ? ಪಾಯಿಂಟ್ಗೆ ಬರೋಣ. ಇನ್ನು ಅವಳು ಒರೆಸೋದ್ ಬಗ್ಗೆನೇ ಮಾತಾಡ್ತಾ ಇದ್ದಾರೆ ಬ್ಲೂದು. ಆಮೇಲೆ ಒರೆಸೋಣ ಮನೆ. ಓಕೆ, ದ ಥಿಂಗ್ ಇಸ್ ಸೆಂಟ್ರಲ್ ಒಬೆಸಿಟಿ ಹೇಳ್ತೀವಿ. ಐದರ್ ಇಟ್ ಇಸ್ ಮೆನ್ ಆರ್ ವುಮೆನ್. ಏನಾಗುತ್ತೆ, ಎವ್ರಿ cc, every ml of your fat which is there is going to get converted. ಏನಾಗುತ್ತೆ, it becomes estrogen. So already you have estrogen, progesterone coming from your ovaries, and you have extra estrogen coming from these places. Whether you have your menstrual cycles or menopause, whatever is this is continuously supplying your estrogen. Okay, but when you do physical activity ಅಂದ್ರೆ ಏನು? Physical activity ಅಂದ್ರೆ ಏನು? During exercise. ಅದೇಮ್ಮ physical activity. Exam definition ಕೇಳಿಲ್ಲಮ್ಮ. ಏನು ಮಾಡ್ತೀಯ ಕೇಳಮ್ಮ. Walking. So they define different. So the obesity cannot be pear-shaped, cannot be apple-shaped. It should be V-shaped. ಜೆಂಟ್ಸ್ಗೆ ಅಂದರೆ ಶೋಲ್ಡರ್ ದೊಡ್ಡದಾಗಿ ಅಗಲ ಇರಬೇಕು, ಹಿಪ್ ಸೈಜ್ ಕಡಿಮೆ ಬರಬೇಕು. ಇಟ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಲೈಕ್ ದಿಸ್ ಇನ್ವರ್ಟೆಡ್ ಟ್ರಯಾಂಗಲ್. ಬಟ್ ಲೇಡೀಸ್ಗೆ ಇಟ್ ಶುಡ್ ಬಿ ಶೋಲ್ಡರ್ ಸೈಜ್ನ ಹಿಪ್ ಸೈಜ್ ಇರಬೇಕು. ಶೋಲ್ಡರ್ ಸೈಜ್ ಚೇಂಜ್ ಮಾಡೋದಕ್ಕಾಗಲ್ಲ. ಯು ಕ್ಯಾನ್ ನೆವರ್ ಚೇಂಜ್ ಇಟ್. ದಟ್ ಇಸ್ ವೈ ಯುವರ್ ಹಿಪ್ ಸೈಜ್ ಸರ್ಕಂಫರೆನ್ಸ್, ಇಫ್ ಯು ಬ್ರಿಂಗ್ ಇಟ್, ಇಟ್ ಹ್ಯಾಸ್ ಟು ಕಮ್ ಅಟ್ ದಿಸ್ ಲೆವೆಲ್. ವಾಟ್ ಇಸ್ ದ ಸರ್ಕಂಫರೆನ್ಸ್? Because this will never increase in size. Whatever you have grown up, that much only will be staying back. Now, so hagagi, next thing, whatever I have told is obesity and then parity. ಯಾವ್ದು ಜಾಸ್ತಿ ಮಾಡಿದ್ರೇನು ತಪ್ಪು, ಕಡಿಮೆ ಮಾಡಿದ್ರೇನು ತಪ್ಪು. Okay, you cannot have 10 children also, and you cannot say my career is important and I will not have children. Okay, when is the right age for giving a child? What is the risk factor for breast cancer? If you give birth to a child beyond 30 years, I mean first child, not the 10th child. I'm not talking about the 10th child, okay? So, first child, if it goes beyond 30 years, it is not healthy for the child as well as for the mother. Mother will have breast development yavaga agbeku aglilla. What is the purpose of the breast? Not for the beauty or cosmetic purposes or anything else. It is only for feeding the baby. Like a dog feeds his puppies, like a donkey feeds its kids, you are also going to feed your kid. And that is why a dog or gives right to 8 puppies, it will have 8 breasts. Possibilities of giving 8 puppies. So they will have 8 breasts, 8 nipples, and all the puppies will be going and drinking milk. But a human being can give only maximum 1 to 2 children. That is why we have maximum only 2 breasts. You got it? But the mammary line exists. I'm not joking. This is the evolution of biology. If you're biology students, you will know. So that mammary line exists, and sometimes people will have rudimentary breast and rudimentary nipple. So what happens is this rudimentary breast line comes from your axillary line to the umbilicus. So ಈ ಜಾಗದಲ್ಲಿ extra nipples ಇದ್ರೆ it can be like moles or extra small breast. Please don't worry, this is normal. Okay, so these are the things I'm making you understand. The third thing, multiparous and nulliparous. ಜಾಸ್ತಿ ಮಕ್ಕಳು ತಗೊಂಡ್ರೆ ಬೇರೆ ಕಾಯಿಲೆ ಬರುತ್ತೆ, ಮಕ್ಕಳೇ ಹುಟ್ಟಿರಲ್ಲ. Nulliparous is the highest risk factor for breast cancer. Please remember that. I don't want to give birth children, it's up to you, but please check for your breast operations. Because, and then the second, third thing, ನನಗೆ ಇವಾಗ periods ಬೇಡ, I want to go somewhere, I'll postpone the periods, I simply take hormones. And I don't want to get surgery done. There are a lot of people in Africa, Philippines, everywhere. They'll just implant progesterone implants for 5 years and everything. Not IUCD. I'm not talking about IUCDs or copper Ts and everything. It is about hormone tablets, OCP pills. You take for more than 6 months or 3 years or 5 years, you have very high risk for breast cancer. Avoid anything that is not normal. Okay? Normal cycle is you have to get your regular periods and everything. If you're doing anything abnormal, it is going to show its effect in a later time. Third thing, this is what I'm going to talk. Food ಹೆಂಗೆ ತಿನ್ಬೇಕಮ್ಮ? ಏನಮ್ಮ? So this is what they recommend. I'm not going to talk what not to take. That is up to you. Taco Bell ಹೋಗ್ತೀರಾ, McDonald's ಹೋಗ್ತೀರಾ, KFC ಹೋಗ್ತೀರಾ. That is depends. Okay? ಅದರಲ್ಲಿ ಲೆಟ್ಯೂಸ್, ಕ್ಯಾರೆಟ್, ಕ್ಯಾಬೇಜ್ ಅದೆಲ್ಲ ಇಟ್ಟರೆ ತೆಗೆದು ಅದೆಲ್ಲ ರಿಮೂವ್ ಮಾಡಿ ಬರೀ ಒಂದು ಎಕ್ಸ್ಟ್ರಾ ಚೀಸ್ ಅಂದರೆ ಯೋಚನೆ ಮಾಡ್ಕೊಳ್ಳಿ. Okay? Whatever you are eating should be like this. Whether it is your breakfast or lunch or diet, night, it should be a balance. There is nothing called I don't eat in the morning, I don't eat in the afternoon. Zero figure ilve illa. Kareena Kapoor ivaga nan size ಗೆ ಬಂದ್ಬಿಟ್ಟಿದ್ದಾಳೆ. Okay, in spite of having too much of gym and every activities. Okay, so what happens is, and ಇನ್ನೊಂದು ವಿಷಯ, ನಿಮಗೆ ವಯಸ್ಸಾಗ್ಬಿಟ್ಟಿದೆ, so you can be fat. From where this criteria comes, I don't understand. Who defined that if I am 60 years, I am 60 kg, 80 years, 80 kg? There is no logic like that. Whatever it is, it's only height by weight ratio. There is no relation to the age. So your food should be like this. If you are eating this much of rice, it should be equivalent to the amount of vegetables and same amount of proteins. Okay? Anna sambar tandre, palya ellide, sambar ellide, pappu ellide, sambar ellide. ಅನ್ನ ಮಾತ್ರ ಅನ್ನ ಸಾಂಬಾರು, ಅನ್ನ ಸಾರು, ಅನ್ನ ಹುಳಿ ಸಾರು, ಅನ್ನ ಮೆಣಸು ಸಾರು, ಆಮೇಲೆ ಅನ್ನ ಬಸ್ಸಾರು, ಅನ್ನ ಒಡಿಸೆ ಲಾಸ್ಟ್ ಮಜ್ಜಿಗೆ. ದಟ್ಸ್ ಆಲ್ ಐ ಈಟ್. ಇದರಲ್ಲಿ ಎಷ್ಟು ಯಾವುದು ಜಾಸ್ತಿ ಇತ್ತು? ಅನ್ನ. ವಾಟ್ ವಾಸ್ ಇಟ್? ಇಟ್ ಶುಡ್ ಬಿ ಓನ್ಲಿ 1/4 ಆಫ್ ಇಟ್. ಓಕೆ? ಸೊ ನಾಳೆ ನೀವು ತಿಂದರೆ ಎಷ್ಟು ಅನ್ನ ಪಲ್ಯ ತಿಂತೀರಾ ಅಷ್ಟೇ ಅನ್ನ. ಎಷ್ಟು ಜನ ಪಲ್ಯ ತೊಗೊಂಡು ಬರ್ತೀರಾ ದಿನ? ಒಂದೇ ಡಬ್ಬ ಮೇಡಮ್. ಚಿತ್ರಾನ್ನ ಮೇಡಮ್. ಚಿತ್ರಾನ್ನ ಅಲ್ಲಿ ಪ್ರೋಟೀನ್ಸ್ ಎಲ್ಲಿದೆ? ಐ ಆಮ್ ಸ್ಟಿಲ್ ಸರ್ಚಿಂಗ್. ಒಂದು ಚೆನ್ನ ದಾಲ್ ಹಾಕಿದೆ ತಡ್ಕಕ್ಕೆ, ಕರೆಕ್ಟ್ನಾ? ಚೆನ್ನ ದಾಲ್ ಉರದ್ ದಾಲ್ ಹಾಕಿದೆ. ಇಸ್ ದಟ್ ಈಕ್ವಲೆಂಟ್ ಟು ದ ಅಮೌಂಟ್ ಆಫ್ ರೈಸ್? ನೋ. ಸೊ ದ ಪ್ರೋಟೀನ್ ಶುಡ್ ಬಿ ಈಕ್ವಲೆಂಟ್ ಟು ರೈಸ್. Protein, vegetable should be equivalent to your rice. Then you can have any fresh vegetables or fruits, of course with a cup of curd or milk. Okay? How many of you are going to eat from tomorrow like this? ಇದು ಮಾಡೋದಕ್ಕೆ ನನಗೆ ಟೈಮ್ ಆಗುತ್ತೆ, 1 hour ಪರ್ಮಿಷನ್ ಬೇಕು ಅಲ್ವಾ? ಸೊ ನಾವು ದ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಕಾಂಪ್ಲಿಕೇಶನ್ ಕಮ್ಸ್ ಹಿಯರ್. ದಿಸ್ ವಿ ಹ್ಯಾವ್ ನೆವರ್ ಥಾಟ್ ಅಬೌಟ್ ಇಟ್, ಅಂಡ್ ನೋಬಡಿ ಈಸ್ ಗೋಯಿಂಗ್ ಟು ಡೂ ಟ್ರಯಲ್ಸ್ ಅಬೌಟ್ ದಿಸ್. ಐ ಆಮ್ ನಾಟ್ ಗೋಯಿಂಗ್ ಟು ಡೂ ರ್ಯಾಂಡಮೈಸ್ ಕಂಟ್ರೋಲ್ ಟ್ರಯಲ್. ನೀವು ಟೇಕ್ ಅವೇ ಪ್ಲಾಸ್ಟಿಕ್ ಕವರಲ್ಲಿ ಮಾಡಿದ್ದೀರಾ, ಇವರು ಟೇಕ್ ಅವೇ ಪ್ರಾಪರ್ ಟಿಫನ್ ಬಾಕ್ಸ್ ಡಬ್ಬದಲ್ಲಿ ತೊಗೊಂಡು ಹೋಗಿದ್ದಾರೆ, ಇವ್ರಿಗೆ ಕ್ಯಾನ್ಸರ್ ಬರಲ್ಲ, ಅವ್ರಿಗೆ ಕ್ಯಾನ್ಸರ್ ಬಂತು. ನೋಬಡಿ ಈಸ್ ಗೋಯಿಂಗ್ ಟು ಟೆಲ್ ಆಲ್ ದೀಸ್ ಥಿಂಗ್ಸ್. ದಿಸ್ ಇಸ್ ಕಾಮನ್ ಸೆನ್ಸ್ ಲಾಜಿಕ್. This plastic cover was invented to put something, some kachra or whatever it is, but not something hot, busy sambar na haki kodi. Alli you do not know whether that cover will break off anytime because of the heat. Correct ah tappa? Yes andre enu correct ah tappa na option. Correct ah? Naale indu sambar busy cover alli tagoltira? ಓಕೆ. ಚಾಯ್ ಪ್ಲಾಸ್ಟಿಕ್ ಕಪ್ಪಲ್ಲಿ ಹೇಗೆ ಕುಡಿಬೋದು? ದಟ್ ಪ್ಲಾಸ್ಟಿಕ್ ಕಪ್ ನಿಮಗೆ FDA ಕೊಟ್ರಾ? ಓಕೆ, ದಿಸ್ ಇಸ್ ನಾನ್ ಟಾಕ್ಸಿಕ್, ನಾನ್ ಕೆಮಿಕಲ್, ನಾನ್ ಕ್ಯಾನ್ಸರ್, ಕಾರ್ಸಿನೋಜೆನಿಕ್. ಟಪ್ಪರ್ ವೇರ್ಗೆ ಹಾಕ್ತಾರೆ. ಆ ಟಪ್ಪರ್ ವೇರೆ ನೀವು 1 ವರ್ಷ ಆದಮೇಲೆ ಬಿಸಾಕ್ಬಿಡ್ತೀರಾ. ವೈ? ಹೌ ಡಿಡ್ ಇಟ್ ಚೇಂಜ್? ಇಫ್ ಯು ಸೇ ಟಪ್ಪರ್ ವೇರ್ ಇಸ್ ನಾನ್ ಟಾಕ್ಸಿಕ್. ನಿನ್ನೆ ನನ್ನ ಸೆಕ್ರೆಟ್ರಿ, ಐ ಹ್ಯಾಡ್ half an hour ಲೆಕ್ಚರ್ ಫಾರ್ ಹರ್. ಪಾಪ ಅವ್ರು ನೀರೇ ಕುಡಿಯಲ್ಲ. ಬಿಸಿ ಬಿಸಿ ನೀರು ಅಲ್ಲೊಂದು ತೊಗೊಂಡು ಬಂದು ಟಪ್ಪರ್ ವೇರಲ್ಲಿ. ದ ಟಪ್ಪರ್ ವೇರ್ ಇಸ್ ಲೈಕ್ ದಿಸ್ ನೌ. I said, and reusing that plastic bottles, that is one hot concept I cannot accept it. ಅದರಲ್ಲಿ ಬಿಸಿ ನೀರು ಕುಡಿಯೋದೇ ಯಾಕೆ ನನಗೇನು ಗೊತ್ತಿಲ್ಲ. ಅದರಲ್ಲಿ ಪ್ಲಾಸ್ಟಿಕ್ ಬಾಟ್ಲಲ್ಲಿ ಬಿಸಿ ನೀರು ಕುಡಿಬೇಕು, ಅದು ರೀಯೂಸಬಲ್ಗೆ ಇಲ್ಲ. ಅದು ಅವ್ರು ಅದರಲ್ಲಿ ಕ್ಲಿಯರ್ ಆಗಿ ಬರೆದಿರ್ತಾರೆ, ಓನ್ಲಿ ಫಾರ್ ಸಿಂಗಲ್ ಯೂಸ್ ಓನ್ಲಿ. ಅದು ಬೇರೆ ನಾವು ಕ್ರಷ್ ಮಾಡಿ ಅದರಲ್ಲಿ ಒಂದು ಸತಿ ಅದು ಕ್ರಷ್ ಮಾಡಿಬಿಟ್ರೆ ಇಟ್ ಸ್ಟಾರ್ಟ್ ರಿಲೀಸಿಂಗ್ ಟಾಕ್ಸಿಕ್ ಕೆಮಿಕಲ್ಸ್ ಬಿಕಾಸ್ ಇಟ್ ಇಸ್ ಬ್ರೋಕನ್. ರೈಟ್? ಆರ್ ಯು ಲಿಸ್ನಿಂಗ್? ಒಂದು ಸತೆ ಆ ಕ್ರಷ್ ಬಾಟಲ್ನ ಕ್ರಷ್ ಮಾಡಿಬಿಟ್ರೆ ಇಟ್ ವಿಲ್ ಸ್ಟಾರ್ಟ್ ರಿಲೀಸಿಂಗ್ ಕೆಮಿಕಲ್ಸ್. ಯು ಕೆನಾಟ್ ರೀಯೂಸ್ ಇಟ್. ಅದರಲ್ಲಿ ಬಿಸಿನೀರು ಬೇರೆ ಹಾಕ್ಬಿಟ್ರೆ ಡೋಂಟ್ ಆಸ್ಕ್ ಮೀ, ಯು ವಿಲ್ ಒನ್ ಡೇ ಯು ವಿಲ್ ಕಮ್ ಟು ಮೈ OPD. ಓಕೆ? And then the last thing, I know I told you about the diet, I told you about what all the things that we are doing. Okay, ಇದೆಲ್ಲ ಸಣ್ಣ ಪುಟ್ಟ ವಿಷಯ. ಅಂಡ್ ಥರ್ಮೋಕೋಲಲ್ಲಿ ಹಾಗೆ ಮೈಕ್ರೋವೇವ್ ಅವನಲ್ಲಿ ಹೀಟ್ ಮಾಡಿ ಕೊಡ್ಬೋದು. ಹೂ ಇನ್ವೆಂಟೆಡ್ ದೀಸ್ ಕಾನ್ಸೆಪ್ಟ್? ಐ ಆಮ್ ಸ್ಟಿಲ್ ಸರ್ಚಿಂಗ್ ಫಾರ್ ದಟ್ ಪರ್ಸನ್. Okay, all these are easy for the person to sell, not for you to get. Okay, my canteen wala will give a thermocol to everybody. When I go there, he will easily put one glass bowl and give it to me. Because ನಾನು ಜಗಳ ಮಾಡ್ತಾ ಇದ್ದೀನಿ, ನನಗೆ ಗೊತ್ತು, ನನಗೆ ಬೇಡ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದೀನಿ. I don't want. If I go to hotel or somewhere, I take my tiffin box dabba, I get it and come. What is a tiffin box dabba? Yes, any metal, non-toxic metal, non-reacting metal. Not necessarily, I have not promoted copper appa. Please don't say from tomorrow I'll drink only copper bottom. Adrulli neer itre I'll become non-personal. Please, it will become extremely toxic because you don't know the content of your water which is going to react with copper. So don't promote copper bottoms or anything. Non-reactive is only stainless steel. It doesn't react with anything. So there are copper vessels and bottoms. How to use they knew. You don't know. So better use things which you know. And simple is, what is the most simplest thing? Yaar, glass. Glass only dabba itkolli, glass only bottle itkolli, glass only easiest. And you have to be a little more careful. Okay? So the last important thing, preservatives and coloring agents. Gobi Manchurian, yav color alli irbeku? Red, orange, purple, rose. But gobi nange gottirada half white alli barutte. ಆ ಗೋಬಿ ಅದರಲ್ಲಿ ಹಾಕಿರೋದು ಬೇಸನ್ ಹಿಟ್ಟು. I am putting on besan flour and rice flour or corn flour. None of this had red color. Where did this red color come from? ನನ್ನ ಮನೆ ಚಿಲ್ಲಿ ಪೌಡರ್ ಅಷ್ಟು ರೆಡ್ ಬಂದಿಲ್ಲಮ್ಮ, ಎಲ್ಲಿಂದ ಬಂತು? ಕೆಚಪ್ ಬೇರೆ, ಓಕೆ, ಶ್ಯೂರ್. ಅಜಿನೋಮೋಟೊ ಬೇರೆ, ಓಕೆ, ಗುಡ್, ಯಾ, ಸೈಡ್. ಓಕೆ, ಸೊ ಪ್ಲೀಸ್, the product which you have brought, if it is not belonging to the natural color, it is not healthy. Clear? Bindi brown agidreno tappu. Brown agi fry madine nan tayi kodtare. That potato should become brown. Okay, all these are not healthy. Period. Ashte. Okay? So red velvet cake na muttadre kai red agbaradu. Correct? And chicken gravy eno tindre kai ella kempagirutte. Illadre green agirutte. All these things are not allowed. Eat whatever it is, natural color. Hage tindre ಏನಾಗಲ್ಲ. Green color ಅಲ್ಲಿ ತಿಂದ್ರೇನೇ ಒಳಗೆ ಹೋಗುತ್ತೆ. ಇಲ್ಲ. Nothing like that. Okay? Nobody defines the color. We have given that is for improving your appetite and ಇಳಿಬೇಕಲ್ವಾ. You have to go to that shop and eat it. That is why these coloring agents are very appealing and attracting, but it is not healthier. Okay? Now we have read. Now physical activity. ನಾವೆಲ್ಲ ಫಿಸಿಕಲ್ ಆ್ಯಕ್ಟಿವಿಟಿ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್, ಆಡೋದು, ಓಡೋದು, ಏನಾದ್ರೂ ಮಾಡಿ, ಡ್ಯಾನ್ಸ್ ಮಾಡೋದು, ಜುಂಬಾ ಮಾಡೋದು, ಇಲ್ಲ ಉಲ್ಟಾವಾಗಿ ನಿಲ್ತ್ಕೊಳ್ಳೋದು ನಾವು ಮಾಡ್ಬೋದು. ಐ ಡೋಂಟ್ ಮೈಂಡ್, ಬಟ್ ಡೂ ಸಮಥಿಂಗ್. ಡೋಂಟ್ ಜಸ್ಟ್ ಕೀಪ್ ಸಿಟ್ಟಿಂಗ್. ಓಕೆ? ಸೊ ವಾಟ್ ಹ್ಯಾಪನ್ಸ್ ಇಸ್ ದೇ ಸೇ, ಹೌ ಡು ವಿ ಕ್ಯಾಲ್ಕುಲೇಟ್? ನಾನು ದಿನ ವಾಕಿಂಗ್ ಹೋಗ್ತಾ ಇದ್ದೀನಿ ಮೇಡಮ್. ಆಲ್ಮೋಸ್ಟ್ ಆಲ್ ಆಫ್ ಯು ಟೆಲ್ ಮೀ ದ್ಯಾಟ್ ಇಷ್ಟು ವರ್ಷದಿಂದ ವಾಕಿಂಗ್ ಹೋಗ್ತಾ ಇದ್ದೀನಿ. ವಾಟ್ ಇಸ್ ಗೈಡ್ಲೈನ್ ಸೇಸ್? ನೀವು ಹೆಂಗೆ ನಡಿಬೇಕಂದ್ರೆ, ಯು ಹ್ಯಾವ್ ಟು ವಾಕ್ ಲೈಕ್ ದಿಸ್ ಫಾಸ್ಟರ್. Okay, and I'm walking, I will not be able to talk. See, I'm walking like that. This is the speed I have to walk. I have to feel breathless if I'm able to. Is this walking? This is also walking. This is the walking for most of them, right? That I can talk the entire history, and most of them, I don't know what is that walking for. Finish all the calls that I have to do on the phone, and then I've also finished walking. The speed is like this. You have to walk in a speed that you are not able to talk. Period. ಮಾತಾಡೋದು ಬಂದ್ಬಿಟ್ರೆ ನೀವು ಸ್ಪೀಡ್ ಇಲ್ಲ ಎಸ್ ಜರುಗಿ ದರ್ ಶುಡ್ ಬಿ ಸಂಬಡಿ ಲೈಕ್ ತಿರುಪತಿ ಹೋಗ್ತಾರೆ ಲೈಕ್ ದೀಸ್ ಆರ್ ದ ಥಿಂಗ್ಸ್. ಆ್ಯಂಡ್ ಇಫ್ ಸಂಬಡಿ ಸೇಸ್ ಐ ಡೂ ಯೋಗ ಎವ್ರಿ ಡೇ, yoga is for relaxing and stretching and toning the muscles, not calorie expenditure. So it will not help you in the definitions of the physical activity that we say. So whatever physical activity you want to run, swim, cycle or walk, you have to do it. This is called moderate activity. ಈ ಸ್ಪೀಡಲ್ಲಿ ಮಾಡಿದ್ರೆ moderate activity. Vigorous ಅಂದರೆ ಬೆವರು ಬಂದು ಓಡಿ ಫುಲ್ that's all ಬಿಡಬೇಕು, ರೈಟ್, ಆಂಬುಲೆನ್ಸ್ ಕರಿಬೇಕು. ದಟ್ ಇಸ್ ಕಾಲ್ಡ್ ವಿಗರಸ್ ಆಕ್ಟಿವಿಟಿ. ಇಫ್ ಯು ಡೂ ವಿಗರಸ್ ಆಕ್ಟಿವಿಟಿ half an hour is enough. But if you do moderate activity, half an hour is enough. 45 minutes of moderate activity for at least 5 days in a week period, you are going to reduce all your cancers risk by 75%. And most important thing, ಯಾಕೆ ಈ ಥರ ಹಾಕಿದೆ ಪಿಕ್ಚರ್, ಜಿಮ್ಗೆ ಹೋಗಿ ಮಾಡೋದು ಇಲ್ಲ, ನೀವು ಕೊಟ್ಟಿರೋ ಸಬ್ಸ್ಕ್ರಿಪ್ಷನ್ ನಂದಿಲ್ಲ. ಇಫ್ ಯು ಗೋಯಿಂಗ್ ಟು ಗೋ ಟು ಆ್ಯಪಲ್ ಜಿಮ್ ಆ್ಯಂಡ್ ಟೆಲ್ ಮಾದಂಗಿ ಮೇಡಮ್ ಹೇಳಿದರೆ ನನಗೆ ಕನ್ಸೆಷನ್ ಕೊಡಿ, ನಾನು ಬರಲ್ಲ. ಓಕೆ, ನೋ ಬಡಿ ಎನ್ಕರೇಜಸ್ ಯುವರ್ ಇಂಡೋರ್ ಆ್ಯಕ್ಟಿವಿಟೀಸ್ ಪೀರಿಯಡ್. ಆಲ್ ದೀಸ್ ಆ್ಯಕ್ಟಿವಿಟೀಸ್ ಶುಡ್ ಬಿ ಡನ್ ಇನ್ ಬ್ರೈಟ್ ಸನ್ಲೈಟ್. ಓಕೆ, ನನ್ನ ಮಾವ ಹೂ ವಾಸ್ ಡೂಯಿಂಗ್ ಇಟ್, ಹಿ ಗೋಸ್ ಫಾರ್ ರೆಗ್ಯುಲರ್ ವಾಕಿಂಗ್. ಮಾರ್ನಿಂಗ್ 5 o'clock ಹೋಗ್ತಾ ಇದೆ, ನಾಳಿಂದ 4 o'clock ಹೋಗ್ತೀನಿ. ಬಸ್ ಏನು ಮಿಡ್ನೈಟ್ ನಡೀರಿ. ದ ಪಾಯಿಂಟ್ ಇಸ್ ಯು ಆರ್ ನಾಟ್ ಗೆಟಿಂಗ್ ಎಕ್ಸ್ಪೋಸ್ ಟು ಸನ್ಲೈಟ್. You are not protected. Sunlight gives you immunity, protects you from depression, gives you immunity against cancer. Okay, whatever physical activity, all of you have never got exposed. That is why I've been telling, sunlight exposure and physical activity when your breast is developing, that is when your menarche or the first periods will go beyond 10 years or 11 years. If it comes early, which means you have not done justice to your daughters. Okay, that's it. So sunlight, vitamin D is done. Now mental health, last. Mental patient appa avrilla, mental agi khushiyagira. Okay, so how many of you are stressed? Adu 95%. Okay, how many of you are anxious? How many of you are depressed? All of us are depressed, anxious. ಏನಿಲ್ಲ ಮೇಡಮ್, ಲೈಫಲ್ಲಿ ಖುಷಿನೇ ಇಲ್ಲ ಮೇಡಮ್, ಬನ್ನಿ ಒಂದು ರೌಂಡ್ ಹಾಕೋಣ. ಓಕೆ, ಸೊ ದಟ್ಸ್ ದ ನೆಕ್ಸ್ಟ್ ಲೈನ್. ಓಕೆ, ದಟ್ ಈಸ್ ದ ಕಾನ್ಸೆಪ್ಟ್ ಆಫ್ ಬ್ಯಾಂಗ್ಳೂರ್. ಏನಾದರೂ ಮಾಡಿದ್ರೆ ಬನ್ನಿ ಒಂದು ರೌಂಡ್ ಹಾಕೋಣ, ಏನಿದ್ರೇನು ಖುಷಿ ಇದ್ರೇನೋ ಒಂದು ರೌಂಡ್ ಹಾಕೋಣ, ಏನಾದ್ರು ನ್ಯೂ ಇಯರ್ ರೌಂಡ್ ಹಾಕೋಣ, ಇಯರ್ ಮುಗ್ದಿದೆ ರೌಂಡ್ ಹಾಕೋಣ, ಮಧ್ಯಮದಲ್ಲಿ ಬಂದರೆ ರೌಂಡ್ ಹಾಕೋಣ. ವಾಟ್ ಇಸ್ ದಿಸ್ ರೌಂಡ್? ಐ ಡೋಂಟ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್. ವಿಲ್ ಕಮ್ ಟು ದ್ಯಾಟ್. ಓಕೆ, ಸೊ now what is mental health is the problem of your depression, anxiety, stress, whatever it is because ಯಾಕೆ ನಮಗೆ ಟೆನ್ಷನು? ಯಾಕೆ ಟೆನ್ಷನು? ಫಸ್ಟ್ ರ್ಯಾಂಕ್ ತೊಗೋಬೇಕು, ಮಾರ್ಕ್ಸ್ ತೊಗೋಬೇಕು. ಹಾಂ, ಎಸ್ ಮ್ಯಾಮ್, ಎಕ್ಸಾಮ್ ಹಾಕಿದ್ದಾರೆ, ಕ್ವಶನ್ ಪೇಪರ್ ಇವತ್ತು ಕೊಟ್ಬಿಡ್ತಾರೆ. ಕೊಡಲ್ಲ, ಕ್ವಶನ್ ಪೇಪರ್ ಮುಂಚೆನೇ ಕೊಡಲ್ಲಮ್ಮ, ಎಕ್ಸಾಮ್ ದಿವಸನೇ ಕೊಡ್ತಾರೆ. ಮೇಡಮ್ ನಾನು ಇವಾಗ ಕಳಿಸ್ಬಿಡ್ತಾರೆ ಮನೆಗೆ. ಸೊ ದ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್ ಇಸ್ ದ ಸ್ಟ್ರೆಸ್ ವಾಟ್ ಯು ಹ್ಯಾವ್ ಇಸ್ ಆಲ್ ಬಿಕಾಸ್ ಯು ಆರ್ ಟ್ರೈಂಗ್ ಟುವರ್ಡ್ಸ್ ಅ ಗೋಲ್ ವಿಚ್ ಇಸ್ ನಾಟ್ ಎಕ್ಸಿಸ್ಟಿಂಗ್. ನಾನು ಆ ಥರ ಆಗಬೇಕು ನೀವು ಎಲ್ಲೋ ನೋಡಿಕೊಂಡು ಇಲ್ಲಿ ಏನು ಮಾಡ್ತಾ ಇದ್ದೀರ ಅಂತ ಬಿದ್ದೋಗ್ತಾ ಇದ್ದೀರಾ. ದಟ್ ಇಸ್ ವಾಟ್ ದ ಕಾನ್ಸೆಪ್ಟ್ ಇಸ್. ಎಲ್ಲ ಕಡೆನೂ ಕಾಂಪಿಟೇಷನ್. ನಾನು ಇವಳೊಂದು ಜಾಸ್ತಿ ಆಗಬೇಕು, ಅವಳೊಂದು 1 ಮಾರ್ಕ್ ಜಾಸ್ತಿ ಆಗಬೇಕು, ಅವಳೊಂದು ಚೆನ್ನಾಗಿ ಡ್ರೆಸ್ ಮಾಡ್ಕೊಳ್ಬೇಕು, ಅವಳೊಂದು ನಾನು ಚೆನ್ನಾಗಿ ಕಾಣಿಸ್ತಾ ಇರಬೇಕು. Everybody should say, I am more beautiful, more intelligent, more smart. I am intelligent, I am smart, I am beautiful. Illa, I should be more beautiful, more ideyalva. That is where you get tensed and stressed. Nange wavy hair ide, avalge heng straight hair ide. That lady is looking at me, wow, what a nice wavy hair, curly hair she has. I am saying, I don't even see, nange ellallo hogta ide, nange straight agine niltkollalla, avalde heng straight agi We are not satisfied with whatever we have. Whatever we do, we are not satisfied. ಇದೇ ಚೂಡಿದಾರ್ ನಾವೇ ಹೋಗಿ ತೊಗೊಂಡು ಬಂದಿರ್ತೀವಿ, ಬಟ್ ಅವಳು ಹಾಕೊಂಡಾದ್ಮೇಲೆ ಮೈ ಚೂಡಿದಾರ್ ಇಸ್ ನಾಟ್ ಲುಕಿಂಗ್ ಬ್ರೈಟ್. ವಿ ಓನ್ಲಿ ಗಾಟ್ ಇಟ್. ನೋ, ವೈ ಡೋಂಟ್ ಬಿ ಹ್ಯಾಪಿ ಆ್ಯಂಡ್ ಬಿ ಪ್ರೌಡ್ ಆಫ್ ವಾಟ್ ಯು ಹ್ಯಾವ್. Most important, and the last important thing is you don't want to live in the present. You always want to live about the future. ನಾಳೆ ನಾನು ಏನಾಗಬೇಕು, ಒಂದು ಇನ್ಸ್ಟಾ ಹಾಕ್ಬಿಟ್ರೆ ಎಷ್ಟು ಲೈಕ್ಸ್ ಬರಬೇಕು, ಅವಳು ನನಗೆ ಫ್ರೆಂಡ್ ರಿಕ್ವೆಸ್ಟ್ ಕೊಟ್ಲಾ, ಅವ್ರಿಗೆ ಫ್ರೆಂಡ್ ರಿಕ್ವೆಸ್ಟ್ ಕೊಟ್ಲಾ, She is having 3,491 followers. I have only 3,490 followers. Oh my God. Please, one follower is missing. We are being trained. First rank ತಗೋಬೇಕು, ಕಾಂಪಿಟೇಷನ್ ಅಲ್ಲಿ ಬೆಳಿಬೇಕು, ಸಿಗ್ನಲ್ ಹಾಕಿದ್ರೆ ನಾವು ಸಿಗ್ನಲ್ ಅಲ್ಲಿ ಮುಂದೆ ಯಾರು ನಿಂತ್ಕೊಂಡಿರ್ತಾರೆ, ಒಂದು ಕಾರ್ ನಿಂತ್ಕೊಂಡ್ರೆ ಅಲ್ಲಿ ಟೂ ವೀಲರ್ ಅಲ್ಲಿ ಮುಂದೆ ಹೋಗಿ ಎಲ್ಲ ನಿಂತ್ಕೊಬೇಕು, ಅವನು ಅಡ್ಡ ಹತ್ರ ನಿಂತ್ಕೋಬೇಕು, ಬಿಕಾಸ್ ಕಾರ್ ತೆಗೆದು ಬಿಡಬಾರ್ದು. ಹೌ ಮೆನಿ ಆಫ್ ಯು ಡೂ ದಿಸ್? ನಡ್ಕೊಂಡು ಹೋದ್ರೇನು? ಎಸ್ ಸರ್, ಆಲ್ ಆಫ್ ಅಸ್ ಡೂ. ಬಿಕಾಸ್ ನಾವು ಹಾಗೆ ಬೆಳೆದ್ಬಿಡ್ತೀವಿ. ವಿ ಹ್ಯಾವ್ ಬೀನ್ ಗಿವನ್ ದಟ್ ಕಾಂಪಿಟೇಟಿವ್ ಸ್ಪಿರಿಟ್ ಇನ್ ಅವರ್ ಲೈಫ್. ಇನ್ನೊಬ್ಬರಿಗೆ ಜಾಗ ಬಿಡಬಾರ್ದು. ದಟ್ಸ್ ದ ಓನ್ಲಿ ಬೇಸಿಕ್ ಕಾನ್ಸೆಪ್ಟ್. ನಾನು ಸತ್ತೋಗಿದ್ರೂ ಪರವಾಗಿಲ್ಲ, ಅವಳು ಸತ್ತೋಗಿದ್ದಾಳ ನೋಡ್ಬಿಟ್ಟು ನಾನು ಸತ್ತೋಗ್ಬೇಕು. ದ ಪ್ರಾಬ್ಲಮ್ ಇಸ್ ವಿತ್ ಅವರ್ ವಾಟ್ ಯು ಸೇ ಪೆನ್ಸಿಲ್ upbringing. So at least please correct yourself. You are grown up now. Anymore you should not get influenced by many things. ಅದಕ್ಕೋಸ್ಕರ ನನಗೆ 40 ಮಾರ್ಕ್ಸ್ ಸಾಕು, ನಾಳೆ ತೊಗೊಂಡ್ಬಿಟ್ಟು ನಿನ್ನ ತಂದೆ ತಾಯಿ ಹೊಡೆದ್ರೆ ಡೋಂಟ್ ಕೋಟ್ ಮೀ, ಓಕೆ? ಸೊ ವಿ ಹ್ಯಾವ್ ಇನ್ ರನ್ನಿಂಗ್ ಒನ್ ಕಾನ್ಸೆಪ್ಟ್, ಬಿ ಬೆಟರ್ ದ್ಯಾನ್ ಯುವರ್ ಸೆಲ್ಫ್ ಅಷ್ಟೇ. You have done 40 marks yesterday, okay, I will try for 42. I'll be better than myself yesterday. I'm learning something new, doing something better, growing up a better person. These are the three things. If that is not happening, ನಾನು ಮಾರ್ಕ್ಸ್ ಬೆಳೆಸ್ಬಿಟ್ಟು ಇನ್ನೊಳ್ನ ಸಾಯಿಸ್ಬಿಟ್ಟು ಮಾರ್ಕ್ಸ್ ಬೆಳೆಸ್ಬಿಟ್ಟು, you are not going up as a better person. Are you a better person now? You are worse than yesterday. You are jealous, you are envious, you are hating. You are not concepts. So these are the good concepts that you have to learn. You have to connect with people. Am I connecting with you all? How do I connect here? Wi-Fi, Bluetooth? Wi-Fi, okay. Mental Wi-Fi. Yeah, I understand. So second thing is be active. ಇವಾಗ ಖುಷಿಯಾಗಿದ್ದೀರಾ, ಈ ಥರ ನಗ್ಗಾಡ್ತಾ ಇರಬೇಕು. ದ ಪರ್ಪಸ್ ಆಫ್ ಪೀಪಲ್ ಇಂಟ್ರಾಕ್ಟಿಂಗ್ ವಿತ್ ಇದರ್. ಅವಳು ಬಂದ್ರು ಗೊತ್ತಾ, ಅವಳು ಏನು ಹೇಳಿದ್ರು ಗೊತ್ತಾ, ನಾನು ಒಂದು ಮಾತೇ ಹೇಳ್ತೀನಿ. ದ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್ ಆಫ್ ಅ ಗಾಸಿಪ್, ಯು ನೋ, ನಾನು ಒಂದು ಮಾತೇ ಹೇಳ್ತೀನಿ, ಯಾರ ಹತ್ರನೂ ಹೇಳ್ಬೇಡ. Should never tell anybody. And whatever I am saying, I am only telling it to you. This you would have told at least 108 persons, right? The same lines. That will start like this only. And last tell you, ನಾನು ಹೇಳಿದೆ ನೀನು ಹೇಳ್ಬೇಡ. And ಎಲ್ಲಿಂದೋ ಬಂದ್ರು, you will be standing. ಇವಳ ಬಗ್ಗೆ ನನಗೆ ಹೇಳಿದಾರ, this person has caught me back or this person has bitched me. Basically we are bitching, right? We know how to bitch around and we enjoy bitching. That is not the way. You can talk nice things, you can talk good things, and only three things gives you happiness. Think good, talk good, do good. If that is not there, don't do anything. Don't talk anything, don't think anything. There's no concept. Okay? So if you do that, that will have relieved you out of this anxiety. ನಾನು 100 ಮಾರ್ಕ್ಸ್ ತೆಗಿಬೇಕು, ಅವಳು 99 ಮಾರ್ಕ್ಸ್ ತೆಗಿಬೇಕು ಇಲ್ಲ. ನಾವು 4 ಜನನು 100 ಮಾರ್ಕ್ಸ್ ತೆಗಿಬೇಕು ಜೊತೆ ಕೂತ್ಕೊಂಡು ಓದಿದ್ರೆ ಈ ಆನ್ಸೈಟಿ ಆ್ಯಂಡ್ ಡಿಪ್ರೆಷನ್ ನಿಮಗೆ ಬಂದಿರಲ್ಲ. If you are doing group activities, that is why in colleges they encourage projects. It is because group activity, they don't give you independent projects. Know to form a team, work like a team. If you are together, that is what is called Ubuntu. You know that Ubuntu concept? You will all go and do a homework today. ಏನು ಮೇಡಮ್ ನೀವು ಹೋಮ್ವರ್ಕಾ? ಸಾಕಾಯ್ತು ನಮಗೆ. So there's a concept in Africa when children were made to run race, going for run race. They started running the race, but the children stopped. There was one person coming at the last. They said, we are not here to compete with each other. We are supposed to do something together. So that fellow went and held the hands, and all of them held hands together and they finished the race. That is the concept of African tribes. You have to be together. Together is strength. If you all be together and do together, you will never be stressed or anxious or depressed. And when you're doing group studies, ನಾನು ಅವತ್ತು ಡಿಸ್ಕಸ್ ಮಾಡಿದೆ, she told me that topic, you will get it immediately like that. When you read, I don't want to tell her this topic because this one point give me 1 mark more than her. You will be stressed out because that 1 point only you will remember. 99 points I will be forgetting it. So that's a concept. So keep learning, take notice, keep giving, and keep, what should you give others? You give your time, you give your presence, and give your good words here. ಯಾವುದು ಮಾತಾಡಿದ್ರೇನು ಒಳ್ಳೆ ಮಾತು. ವಾಟ್ ಯು ಸೇ ಸಂಕ್ರಾಂತಿಯಲ್ಲಿ? ಫಿನಿಶ್, ಡನ್. ಎಕ್ಸಾಕ್ಟ್ಲಿ. ಸೊ ಯು ಸ್ಟಾರ್ಟ್ ಯುವರ್ ಇಯರ್ ವಿತ್ ಗುಡ್ ವರ್ಡ್ಸ್. ಎಳ್ಳು ಬೆಲ್ಲ ಕೊಡಿ, ಒಳ್ಳೆ ಮಾತು ಮಾತಾಡಿ. You does not excuse me madam, may I come in? That excuse me is gone, may I come in is gone. That you will not forget what you are telling, but you will be just entering. Okay, this is the concept. ಒಳ್ಳೆ ಮಾತು ಮಾತಾಡಿ ಒಳ್ಳೆ ಇಲ್ಲಿ ನೆನಪು ಒಳ್ಳೇದಿದ್ರೆ ಬಾಯಲ್ಲಿ ಒಳ್ಳೇದು ಬರುತ್ತೆ ಆ್ಯಂಡ್ ಇಟ್ ವಿಲ್ ಬಿ ಸ್ಟ್ರೆಸ್ ಫ್ರೀ. ದ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ರೀಸನ್ ಫಾರ್ ಆಲ್ ದ ಹೆಲ್ತ್ ಡಿಸ್ಟರ್ಬೆನ್ಸಸ್ ಇನ್ಕ್ಲೂಡಿಂಗ್ ಡಯಾಬಿಟಿಸ್, ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್, ವಾಟ್ ಎವರ್ ಯು ಸೇ ಇಸ್ ದಿಸ್ slide. So if you are not mentally all right, you can never become physically all right. So what are you going to do now from on? Am I smiling? Yes. Am I looking better with a smile? Yes. Thank you. How are you all looking? Yes, ma'am. You are also looking nice with a smile, ma'am. Yes. Now it's like 1,000-watt bulb there. Yeah, it is looking very bright. So that is what is the concept. Anything that happened, you have to just say, that's okay. ಉಳ್ದಿರೋರು ತಪ್ಪು ಮಾಡಿದ್ರೆ that's okay. ನಾನು ತಪ್ಪು ಮಾಡಿದ್ರೆ so what? We can correct it, yeah? No problem. Don't get tensed. Nothing is going to change in this world. And there is no, say, can I tell you one thing? Okay, tell me who's the best doctor in Bangalore? All of you will tell one name. Best engineer? All of you will tell one name. Best professor? You will tell one name. There is nobody called best. If I go today, probably if I'm not available, some other doctor will take my place. No, Kamal, whatever it is, I will only come. Here 1 hour, there 1 hour, there 1 hour. Wow, what will I do? No. If it is possible for me, I'll come. If it is not possible, it's okay, yaar. You come. Okay? So now, coming to the habits. How many of you do this? ಎಲ್ಲ ಇಡೋಕ್ಕೂ ತಂಬಾಕು, ಜರ್ದ, ಪಾನ್, ಬೀಡ, ಗುಟ್ಕಾ, ಹನ್ಸು, ಮಧು, ಮೇಲೆ ಇಡೋದು, ಕೆಳಗೆ ಇಡೋದು, ನಾಲ್ಗೆಲ್ಲಿ ಇಡೋದು, ಮೂಗಲ್ಲಿ ಇಡೋದು, ಕಣ್ಣಲ್ಲಿ ಇಡೋದು, whatever it is. By the time I ask this list, patient ಎಲ್ಲ ಹೇಳ್ಬಿಟ್ಟು ಅದೆಲ್ಲ ಮಾಡಲ್ಲಮ್ಮ, ಏನು ಮಾಡಿಲ್ಲಮ್ಮ. ಕೇಳಿದ್ರೆ ಮಾಡಿಲ್ವಾ? Then how did the cancer come? I keep thinking, ನಿನ್ನೆ ಬಿಟ್ಟೆ, ಬಯೋಪ್ಸಿ ರಿಪೋರ್ಟ್ ಬಂತಲ್ವಾ ಆವಾಗ ಬಿಟ್ಟೆ. ಸೊ ಯಾವಾಗ ಶುರು ಮಾಡಿ 5 ವರ್ಷ ಮಾಡಿದೆಮ್ಮ. ಈಸ್ 55 years. 50 yearsಲ್ಲಿ ಯಾರಾದ್ರೂ ತಂಬಾಕು ಶುರು ಮಾಡ್ತಾರೆ? ಐ ಗೆಟ್ ಮೈ ಡೌಟ್. ಸರಿ, ಅದೆಲ್ಲ ಬಿಡಿ, ಎಷ್ಟು ವಯಸ್ಸಲ್ಲಿ ಶುರು ಮಾಡಿದೆ? 13 ವಯಸ್ಸಲ್ಲಿ. ಸೊ 13 ವಯಸ್ಸಿಂದ 55 ವರ್ಷ 5 ವರ್ಷ. ಓಕೆ, ದಟ್ ಇಸ್ ಹೌ ಮೈ ಕಾನ್ಸೆಪ್ಟ್ಸ್ ಆರ್. Okay, so if you say that Shah Rukh Khan came, some nice handsome fellow went over the cliff and say, what is it, Shimla Pan Pasand or whatever it is. See, everybody now remembers. Handsome people andre everybody remembers. Okay, Zuban Kesari. Boss, brush your teeth properly, boss. If you brush your teeth properly, you don't need Zuban Kesari and all. And you have to have olle maatu, not olle vasne. Okay, if that there is no olle maatu and you talk all dirty things, there is no Zuban Kesari. It is like the, okay, now, I told you, ಒಂದು ರೌಂಡ್ ಹಾಕೋಣ, ಬಂತು, ಆ ಸ್ಲೈಡ್ ಬಂತು, ಒಂದು ರೌಂಡ್. And both of the things, why I go to college and show this slide is, it never starts. ಯಾರಾದ್ರೇನೋ ಡೈರೆಕ್ಟ್ ಆಗಿ ಬಾರ್ಗೆ ಹೋಗಿ ಕುಡ್ದಿದ್ದೀರಾ? Did any of you have, ಯಾರಮ್ಮ ಬಾರ್ ಅಂತ ಹೇಳಿದ್ರೆ? I know that. Bar is the only word she heard. Okay, how many of you who have started drinking goes directly to bar? ಇವತ್ತು ನನಗೆ 18 ಆಗಿದೆ, I have to go to bar and start drinking. How many of you will start? No. How many of you will say, there is something called cigarette in the world, I have to try this today? ಎಷ್ಟು ಜನ ಶುರು ಮಾಡಿದ್ದೀರಾ? ಇಲ್ಲ. ಎಲ್ಲಿಂದ ಬರುತ್ತೆ? ಒಂದು ರೌಂಡ್ ಶುರು ಮಾಡ, ಒಂದೇ ಒಂದು ದಮ್ಮು ಮಚ್ಚ, ಒಂದೇ ದಮ್ಮು ಹಾಕಿ ನೋಡು, ಕುಡಿದು ನೋಡು, ಅವಾಗನೇ ಗೊತ್ತಾಗುತ್ತೆ ಹೂ ಇಸ್ ದಟ್ ಪರ್ಸನ್. ಬ್ಯಾಡ್ ಕಂಪನಿ. Everything starts with the company. Everything stays because of the company. And no father has given the children the cigarette. And the parents are the bad example if they do it. And when I did a lung cancer awareness last year, I still remember it was an all over India session with Pro. And the person it was all high-end intelligent people there. I'm not that intelligent. They are all statistics, high-tech, tech-savvy. People were attending. I was like feeling very scared to talk to these people because they always twist the facts. Okay? He's saying, according to, for some 10 minutes, he continuously talked. According to the statistics in India, these many people are smoking, these many cigarettes are being used, these many BDs are being used, and this is the percentage of cancer. I just kept quiet and he said, why are you still saying that smoking is the reason for cancer? Was that a good statement? That is why I said, if you have statistics, you can even tell that Narendra Modi is my father, right? You can tell, you can draw a tree. Allindu Gujarat indu ondu bantu, allindu bantu, so you belong to Narendra Modi's generation. You can twist facts anyway. So that person was trying to put it across to me that my father has smoked for so many years, he didn't have cancer, and I have been also smoking. Nothing happened to me. I said, why are you educating this? When it happens to you, you are not going to come on the dais and say, boss, because of smoking, I got cancer, please don't smoke. How many of you come on the dais and say? Why do you say wrong messages in the public forum? Don't say that. And the most important concept, last time it was during COVID, right? ಆ ಹೊಗೆ ಅಲ್ಲಿ ಹೋಗಿ ಬೆಂಕಿ ಆಗ್ಬಿಡುತ್ತಂತೆ, ಬಿಸಿ ಆಗ್ಬಿಟ್ಟು ಕೊರೋನಾ ಎಲ್ಲ ಸಾಯಿಸ್ಬಿಡುತ್ತದೆ. What a wonderful concept. Huh? People are not getting, most of the people are coming out of ICU ante. I would have kept one cigarette shop outside ICU, no? ಒಂದು ಇಂಡೆಂಟಲ್ಲಿ ಬರೀ ಬೆಳಗ್ಗೆ ಒಂದು ಸಿಗರೇಟ್, ಮಧ್ಯಾಹ್ನ ಒಂದು ಸಿಗರೇಟ್, ಈವ್ನಿಂಗ್ ಒಂದು ಸಿಗರೇಟ್, ಸಖತ್ತಾಗಿ ದಮ್ ಬೆಳೀರಿ, ಅವಾಗಲೇ ಒಳಗೆ ತನಕ ಎಲ್ಲ ಹೋಗುತ್ತೆ. That's the thing. So, none of the concepts are true. The concept is, only concept stays all over the time period. It has been proven effective is learn how to say no. If you cannot say no, ಪರವಾಗಿಲ್ಲ ಮಚ್ಚ ನೀ ಕುಡಿ ನನಗೇನೂ ಆಗಲ್ಲ, ರೈಟ್? ಒಂದು ದಿವಸ ಅವನು ಕುಡಿತಾನೆ, ಮೂರನೇ ದಿವಸ ನೀನು ಸ್ವಲ್ಪ ಕುಡೀರ ಮಚ್ಚ, ಒಂದೇ ತಾನೆ, ನನಗೆ ಕಂಪನಿ ಕೊಡಲ್ವಾ? These are the problems. And the most important thing, this slide, you know how many of the cancers we are getting in women? 33%. None of them have smoked. It is all because of paravailla macha. Your friend will be smoking here or there, and that fellow should not think you are a, what do you say? ಏನು ಹುಡುಗಿಪ್ಪ, ಹಳ್ಳಿ ಹುಡುಗಿನ ಅನ್ಕೋಬಾರ್ದು ಅಲ್ವಾ? ನಾನು ಫ್ಯಾಷನಬಲ್ ಡ್ಯೂಡ್, ಐ ಶುಡ್ ನೋ, ಇಟ್ಸ್ ಓಕೆ, ಐ ಡೋಂಟ್ ಮೈಂಡ್, it's okay, it's okay. Yeah. Because I have to be fashionable, I have to be full trendy, right? Trendy is like, it's okay, I don't mind. ನನ್ನ ಮನೆಯಲ್ಲಿನೂ ಏನೂ ಹೇಳಲ್ಲ. ಅವನಾದ್ರೇನೋ ಆ ಸಿಗರೆಟಲ್ಲಿ ಫಿಲ್ಟರ್ ಭಾಗ ಒಳಗೆ ಹೋಗ್ತಾ ಇದೆ, ನಿಮಗೆ ಅನ್ಫಿಲ್ಟರ್ಡ್ ಫುಲ್ ಬೀಮ್ಸ್ ಫುಲ್ ಒಳಗೆ ಎಲ್ಲ, ಆಲ್ ಕೆಮಿಕಲ್ಸ್ ಡೈರೆಕ್ಟ್. You know, in one cigarette, when you take one dhamma, they say it is equivalent to keeping your face into a diesel exhaust. ಒಂದು ಹಳೇ ಗಾಡಿ ಸರ್ವಿಸೇ ಮಾಡಿಲ್ಲ ಅಂದರೆ ಡೀಸೆಲ್ ಎಕ್ಸಾಸ್ಟ್ ಹೋಗಿ ಹೆಂಗೆ ಬರುತ್ತೆ, ಒಂದು ಕಪ್ಪಾಗಿ ಒಂದು ಈ ಥರ ಇಳಿತಾ ಇರೋದು ಮುಖನೋ ಕಾರ್ ಎಕ್ಸಾಸ್ಟಲ್ಲಿ ಮುಖ ಇಟ್ಕೊಳ್ಳೋದಕ್ಕೆ ಸಮಾನ, ಒಂದೇ ಒಂದು ದಮ್ಮು. ಓಕೆ, ಆ್ಯಂಡ್ ಹೌ ಮೆನಿ ಕ್ಯಾನ್ಸರ್ಸ್ ಕ್ಯಾನ್ ಕಮ್ ಫ್ರಮ್ ಸ್ಮೋಕಿಂಗ್? Whether it is you smoking, me smoking, how many cancers? 17 types of cancers. 17. ಮೂಗಲ್ಲಿ, ಮೂಗಿನ ಹಿಂದ್ಭಾಗ ನ್ಯಾಸೋಫೆರಿಂಕ್ಸು, ಆಮೇಲೆ ಬಾಯಲ್ಲಿ, ಬಾಯಿ ಕೆಳಗೆ ಓರೋಫೆರಿಂಕ್ಸು, ಗಂಟ್ಲಲ್ಲಿ, ವೋಕಲ್ ಕಾರ್ಡಲ್ಲಿ, ಆಮೇಲೆ ಅನ್ನನಾಳದಲ್ಲಿ, ಶ್ವಾಸನಾಳದಲ್ಲಿ, ಆಮೇಲೆ ಶ್ವಾಸಕೋಶದಲ್ಲಿ, ಅಂಡಕೋಶದಲ್ಲಿ, ಗರ್ಭಕೋಶದಲ್ಲಿ, ಪಿತ್ತಕೋಶದಲ್ಲಿ, ದೆನ್ ಸ್ಟಮಕ್. ಐ ಟೋಲ್ಡ್, ಯಾ, ವಾಟ್ ಇಸ್ ಸ್ಟಮಕ್? ಅನ್ನಕೋಶ. ಓಕೆ, yeah, whatever. So all koshas, whatever you have, urinary bladder, uterus, ovaries, cervix, pancreas, liver, stomach, urinary bladder. Ashte, simple. Colon cancer, I left colon. That's all. But one cigarette, amma cigarette hoge lungs ge hogta ide. Why am I getting in urinary bladder? Right? Because there are 210 chemicals that goes from the hoge into your blood along with your oxygen and goes all over your body, and it obviously gets secreted in the urine. So urinary blood cancer is the most commonest. And drinking, already namdu liver kettogide, ಕೂತು. You all know that your livers are failing the moment you are sitting for longer time. Your sitting time versus standing time ನೀವೇ ಹಾಕಿ ಇವತ್ತಿಂದು. Okay, that is one exercise you have to do. ನಾನು ಹೆಲ್ತಿ ಆಗಿದ್ದೀನಿ, you told all of you are healthy, right? So your sitting time should be 1/3 of your standing time. Okay, standing time elli, that is where we have to think. Okay, so now they say our liver gets corrupted or damaged the more we are getting fatter, because all the fats get deposited in the liver, what is called fatty liver. Most commonest liver failure in India is because of, now in women, is because of fatty liver. ಏನು ಮಾಡಿಲ್ಲ, ನಾನು ಕುಡ್ದಿಲ್ಲ, ಏನು ಮಾಡಿಲ್ಲ, because fatty liver, grade 1, grade 2, grade 3, liver is completely gone. Now genes, you know, we have already talked about this. Now coming to your breast, you know how to know about your breast. Your breast starts from the bone, clavicle bone or the neck bone, to the midline and the axilla and the midline displays and the bulk of the breast. Whether it is men or women, whether you have bulk or not, this is the breast. And you have the armpit area and the nipple areolar complex. This is a normal breast for everybody. Now coming, you can see that the pink color is not only increasing in the streets, it's also increasing in the ಪಿಂಕ್ ಅಥಾನ್, ಪಿಂಕ್ ರೈಡು, ಪಿಂಕ್ ಪೇಸು, ಪಿಂಕ್ ರನ್ ಎಲ್ಲ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಬಟ್ ಯಾರು ಓಡ್ತಾ ಇಲ್ಲ, ಅದು ಅವತ್ತು ಮಾತ್ರನೇ ಎಲ್ಲ ಮಾಡ್ತಾರೆ, ದೆನ್ ದೇ ವಿಲ್ ಫರ್ಗೆಟ್ ಎವ್ರಿಥಿಂಗ್. ಯಾ ಲೈಕ್ ವಿ. ಸೊ ಇಂಡಿಯನ್ ಕ್ಯಾನ್ಸರ್ ಸ್ಟ್ಯಾಟಿಸ್ಟಿಕ್ಸ್, ವೈ ಆರ್ ಯು ವರಿಡ್ ಅಬೌಟ್ ದೀಸ್ ಕ್ಯಾನ್ಸರ್ಸ್? ಯಾ, I told you the first story. Nobody is coming in peanut size. There I can say you will be living, 95% of the people will live for next 20 years. But you come in watermelon and muskmelon size. And I'm only telling probabilities of next 5 years for you to be alive is 5 to 10%. That is why I'm talking. Because you're not ready to listen. You're not ready to talk with each other. Cancer, adu bidi pa. Talk about breast pa. What's the problem? Talk about it. So, good news, as usual, you're always first. First ಆಗಬೇಕಲ್ವಾ? ಟ್ರಾಫಿಕಲ್ಲಿ ಫಸ್ಟು, ಎಲ್ಲದಲ್ಲಿ ಫಸ್ಟು, ಸತ್ತೋಗಿರೋದಲ್ಲೂ ನಾವೇ ಫಸ್ಟು. ದ ಎಂಟೈರ್ ವರ್ಲ್ಡ್ ಇನ್ಸಿಡೆನ್ಸ್ ಇಸ್ ದ ಸೇಮ್. ಅವ್ರ ಥರನೇ ನಮಗೇನೋ ಬರ್ತಾ ಇದೆ, ಸತ್ತೋಗಿರೋದು ಮಾತ್ರ ನಮ್ಮದಲ್ಲಿ ಜಾಸ್ತಿ ಜನ ಸತ್ತೋಗ್ತಾ ಇದ್ದಾರೆ. ವಿ ಆರ್ ದ ಹೈಯೆಸ್ಟ್. ಓಕೆ, ಹೇಗೆಲ್ಲ ನೋಡ್ಬೋದು. ಹೌ ಕ್ಯಾನ್ ಇಟ್ ಕಮ್? ಒಂದು, ಇಟ್ ಕ್ಯಾನ್ ಕಮ್ ಆಸ್ ಅ ಲಂಪ್ ಆರ್ ಇಟ್ ಕ್ಯಾನ್ ಕಮ್ ಆಸ್ ಅ ಸ್ಕಿನ್ ಚೇಂಜ್. ಚರ್ಮದಲ್ಲಿ ಏನಾದ್ರೂ ಕೆಂಪಾಗ್ಬೋದು, ಬ್ಲೂ ಕಲರ್ ಆಗ್ಬೋದು. ನಿಪ್ಪಲಲ್ಲಿ ಏನಾದ್ರೂ ಡಿಸ್ಚಾರ್ಜ್ ಬರ್ಬೋದು. Nipple, this is for men and women. Breast is universal. Please don't think I'm doing women breast cancer awareness. No. Okay, the tottu, whatever you call it as nipple, can be outside, flat or inside. But suddenly, whichever it is outside or flat, has suddenly been pulled inside partially or fully is dangerous. And then you have dimpling or secretions. Some secretions, blood tinged secretions can come. So we have already discussed alcohol, estrogen, diet, physical activity, family history, everything done. Now mind. So now we are going to come something called, madam said, medical tactile examination. That is a nice word which nobody understands. So we have to just repeat it, because medical andre, it is for the medical purposes. Tactile andre, touch. You are going to touch and do the examination. Without touching, I cannot see you and do the examination. So basically, it can be done by yourself, or a doctor or a trained person can do it. So two things. Now, self-breast examination is a must. From what age? From the time you got your breast. Okay, that is when you will know what is happening to my breast. We are not trying to find out if there is a problem with the breast. I am trying to find out what is normal. Idu nun breast. This is normal. Avagne abnormal gottagutte. If you don't know what is normal, will you know what is abnormal? So this breast examination is to know what is normal. So this is only done after the 7th day of the periods. Periods time alli ಮಾಡಬಾರದು, ನೋವಾಗುತ್ತೆ. So periods ನಿಲ್ದೋಗಿನ ಆದ್ಮೇಲೆ, ಇವಾಗ ನನ್ನ ಅಜ್ಜಿಗೆ ಮೆನೋಪಾಸ್ ಬಂದ್ಬಿಟ್ಟಿದೆ, there are no periods, right? So she can do one first Sunday, ಆ ಥರ ಒಂದು ಡೇ ಫಿಕ್ಸ್ ಮಾಡಿಕೊಂಡು you can just do it. There is no relation to periods because ಅವ್ರಿಗೆ it has stopped. Okay, every month you have to get it done. Only 5 minutes test. There are 2 parts, looking and feeling. They have to looking. You have to stand in front of the mirror, keeping your hands on the sides. Normal. Just stand ಮಾಡಿ ನೋಡಿ. Both the sides breast may be equal, not equal. No problem. This is your breast, normal. One side can be bigger, normal. No problem. One side can be no existing. Some people will not even have breast, normal. This is me. I am looking into what is my normal. Are you understanding this? Yes, everybody can stand also and look into it. This PPT and this slides, probably they will share it with you. They have the pamphlets to share it with you. Yeah. So you first is putting your hands down. What are you going to see? Shape, size, symmetry, skin, all the 4. And then how is the nipple? There are people who will have it outside, who will have it flat, or who will be having it inside. Only during feeding it may come out, or during periods or something it may come out. But it was always outside. Now suddenly it is going inside. It is normal, abnormal? Yeah. There is no lump all these days. Now I'm suddenly feeling a lump. And how to feel the lump, I'll tell you later. So all these things, bulging out, skin changes, whatever it is, I'm feeling some changes in these things. And then second thing is, keep your hands like this. Make it prominent and then see. Third thing is, you have to lift your hands to look for your armpits and the under surface of the breast. Period. You are now finished looking. Too much of looking is dangerous, right? So now coming to the feeling part. Yes or no? Feeling part is never like this. Right? Everybody does this, or they does this. This is the breast and then they keep pinching. And gunti ansta ide madam illa. No. Don't pinch your breast. You are not punishing somebody, right? You have to, this is the chest wall and your breast is here. you have to use your flat hand and then feel it like this. Okay, you got my point? So I'm going to feel it with the flat of the hand and not the tip of the hand, flat. I'm not doing it like this. Please correct it yourself. And when I'm doing this, I have to, for example, this is the breast examination. I hope you can see. I'm starting the breast examination. I'm doing it in, this is a circle, right? I'm doing it clearly by minute hand, not by, or minute hand or hour hand. Not like 12 o'clock, 3 o'clock, 6 o'clock, 9 o'clock. What are we looking for? A peanut size change. I'm not looking for a lemon or a watermelon or a muskmelon. So if your peanut size, I have to examine it like this, slowly. And then you have to just feel it. Okay, normal. There may be nodularity, that is your breast tissue, nodularity. But otherly gantu tara idea. And everybody thinks gantu there, no villa, there is no pain, so it is not cancerous. No. Cancerous tissues are not necessarily painful. If it is painful, it is very, very advanced stage. Again, pain may be related to other things like infection, pus, abscess, and other things. So you have done, and if you find out something, you have something. I don't say it is cancerous. There are, according to international guidelines, no person, gynecologist or breast surgeon or even an international specialist cannot say it is cancerous or non-cancerous without doing these 3 tests. This is called triple examination guidelines. I feel with the hand, number 1. Number 2, I do some investigations like ultrasound if you are less than 40, because your mammography, I'll tell you what is mammography, and then do a needle test if there is a gante another, you have to do a needle test. So 3 tests should be done to tell that whether it is cancerous or non-cancerous. Somebody says without doing it is non-cancerous also, it's wrong. You are ignoring something, don't ignore that way. Okay, now this is called mammography. Now ಯಾಕೆ mammography and ultrasound ಮಾಡಬೇಕು? ಕೈಯಲ್ಲಿ ಸಿಗ್ತಾ ಇದೆ ಅಲ್ವಾ, ಗಂಟು ಬಂದರೆ. Now I'm going to look for places ಗಂಟು ಬರೋದಕ್ಕೆ ಮೊದಲು, stage 0, preventing of cancer, ಇನ್ನು ಕ್ಯಾನ್ಸರ್ ಆಗಿಲ್ಲ. Those things I remove, you will not develop cancer. So the breast will be pressed, just touched with between the plates, and I will get an X-ray like this. So ಇದು ಗಂಟು ನನಗೆ ಕೈಗೆ ಸಿಗಲ್ಲ. There are certain calcifications here ಮುಂದೆ ಕಾಣಿಸಲ್ಲ. Okay, so there are nodes here in the armpit which will be seen. And every time mammography, you have to see that the portion of the muscle is included. And then entire posterior portion, last time we have included. If I have included only this much, I would have missed a lesion here. That's why we have to include the muscle so that the entire breast is properly covered. Okay, this is the proper mammography. See, if you see in this also, you can see the muscles. You can see the muscle here, we have to check. This is the indication that it has been done properly. Now, next slide. So this is the thing. I told you some dots in the mammography. This is what the dots are. If such dots, we call it as calcification. Calcium deposits sara irutte. Idu stage 0 cancer irbodu. This is the place where we direct it and put it a needle in the biopsy. This is called in situ. Innu cancer agilla. Alli matra innu changes aagta ide. If we go and remove this tissue, nale cancer baratta. So here, no chemotherapy, no radiation, nothing big deal. Finish. You remove the wrong tissue and you are saved. That is what we are intending to. ಅರ್ಥ ಆಯ್ತಮ್ಮ? ಸ್ಕ್ರೀನಿಂಗ್ ಅಂದರೆ ನಿಮಗೆ ಕಾಯಿಲೆ ಇನ್ನೂ ಬಂದಿಲ್ಲ, ಕಾಯಿಲೆ ಬರಬಾರ್ದು, ನಾವು ಒಂದು ಟೆಸ್ಟ್ ಮಾಡಿ ಅದನ್ನು ತಡೆಗಟ್ಟೋದು. ಕರೆಕ್ಟ್ನಾ? ಸೊ ಬ್ರೆಸ್ಟ್ ಆಯ್ತಾ? ಆಲ್ ಅಂಡರ್ಸ್ಟುಡ್ ವಾಟ್ ಇಸ್ ಸೆಲ್ಫ್ ಬ್ರೆಸ್ಟ್ ಎಕ್ಸಾಮಿನೇಷನ್? ಇಫ್ ಯು ಹ್ಯಾವ್ ಎನಿ ಡೌಟ್ಸ್, ಸೊ ಯು ಕ್ಯಾನ್ ಗೋ ಟು ಯೂಟ್ಯೂಬ್, go open self breast examination by Indian Cancer Society. It is called 3-finger salute. Okay, please open it. Aram se nodi, get your examination done. Plus, please show it to your elders at home who don't have the privilege to attend this talk. That is why I request you, ನಿಮ್ಮ ಸ್ಮಾರ್ಟ್ಫೋನ್ ಇಂದು ಏನಾದರೂ ಉಪಯೋಗ ಆಗುತ್ತೆ ಅಂದರೆ ಸ್ವಲ್ಪ ಜನಗೆ ತೋರಿಸಿ ಅವ್ರನ್ನ ಮಾತಾಡೋಕ್ಕೆ ಹೇಳಿ. Now coming to the second most commonest problems that can happen. ಯೂಟ್ರಸ್ ಅಲ್ಲಿ 3 ಭಾಗ ಇರುತ್ತೆ. ಇದು ovaries, uterus, cervix. ಓಕೆನಾ? Uterus is where you get your eggs from. Ovaries are eggs from. Uterus is where your babies are getting nested, baby's home. Cervix is baby biddogta illa. It's not coming out. Even if it is 3 kg, it's not coming out. Your menstrual cycle is coming out in 2 ml idrena aache barutte. But your 2.5 kilo baby is not coming out. Because this cervix is strong enough to hold the baby. This is the bag where the baby sits. It lies down properly, nesting. This prevents it from coming down. During delivery, it opens up, only then you will get it out. It is called cervix. This is caused by, the cervical cancer is the second most common cancer for Indian women. Unfortunately, 75% of dying. And the most important thing is 100 years before they have found out. Mammography alli calcification ನೋಡಿದಿವಲ್ವಾ ಅದೇ ಥರ ಇದಕ್ಕೊಂದು ಸ್ಕ್ರೀನಿಂಗ್ ಇದೆ ಅದು ಕಂಡಿಡಿದು 100 years ಆಯಿತು. And in Western countries, they are seeing lesions as 2 millimeter and 4 millimeter. India, we are seeing 8 centimeter, 9 centimeter. And it is going and eating up the bladder and urine ತೂತಾಗಿ ಬರ್ತಾನೆ ಇರುತ್ತೆ. ಅವರು ನನ್ನ ಒ ಪಿ ಡಿಯಲ್ಲಿ ಬಂದು ಬಿಟ್ಟು ಹೋಗ್ಬಿಡ್ತಾರೆ ಬಿಕಾಸ್ ವಾಸನೆ ಬರ್ತಾ ಇದೆ. ನಾ ಡಾಕ್ಟರ್ ತೋರ್ಸಕ್ಕೆ ಬಂದು ಒ ಪಿ ಡಿಯಲ್ಲೇ ಬಿಟ್ಟು ಹೋಗ್ಬಿಡ್ತಾರೆ. ದೇ ವಿಲ್ ಬಿ ಆರ್ಫೆಂಡ್ ಇನ್ ಮೋಸ್ಟ್ ಆಫ್ ದ ಪ್ಲೇಸಸ್. 75% are dying in spite of having a screening test. Nobody even, can you name the test? Pap smear. Who said that? Please raise your hands. Madams, no? So that's the thing. That's the difference between knowledge and awareness. She said that. Somebody did the intro today. Madam? Yes, ma'am. So, ನಿಮಗೆಲ್ಲ ನಾಲೆಡ್ಜ್ ಇದೆ, ಬಟ್ ಏನೇನು ಮಾಡಬೇಕು, ವಿಷಯ ಏನು ಗೊತ್ತಾಗಬೇಕು, nobody knew about this. So this has to start. So the virus, HPV virus, enters your uterus area because of sexual life. Ashte. You have not done one partner, second partner, third partner alla. Single partner, single exposure ಆದ್ರೆ HPV virus ಒಳಗೆ ಹೋಗ್ಬಿಡುತ್ತೆ. ಹೋಗ್ಬಿಟ್ರೆ it will become cancerous after 15 years. In between, only on the pap smear ಮಾಡಿದ್ರೇನು you would have found it very early and you could have detected, you will not even have cancer. 15 years you have time. So they say, what are the things? ಬೇಗ ಮದುವೆ ಮಾಡ್ಕೊಳ್ಳೋದು, opposite to breast. They get married at around 17 years, 18 years, wrong. But that is not the concept. Marriage is not the culprit. Even having boyfriends and having sex at 13 years is wrong. So don't blame your parents, okay? And getting this wrong pregnancy and wrong abortions and malabortions. That is what I am worried about here. Premature sex because you don't know how to protect yourself and it leads into a lot of pregnancies. And multiple sexual partners, obviously I told you, HPV infection. So what they say is, screening heng ಮಾಡಬೇಕು, they just do a small test like this. On the brush, small brush, ಇಷ್ಟೊಂದು ಇರುತ್ತೆ. Just put the brush, collect that material and send it for investigation. ದೊಡ್ಡ ಟೆಸ್ಟಾ? ಏನಿಲ್ಲ. Not even big like mammography. You don't need big instruments. Open ಮಾಡಿ just brush ಅಲ್ಲಿ ತೆಗೆದು, you know, self-testing kits are coming out. You can only test yourself. 3 years after the start of your sexual life. ಅಷ್ಟು ಆಗಿಲ್ವಾ? From 30 years, once in 3 years, ಒಂದೇ time test. Until 65 years. That's it. Is the test very, very difficult? You didn't even know about the test. How will you ask for the test? This is called pap smear. So this pap smear has been invented by Papinoculau 100 years before. And India still nobody knows about it, nobody gets it done. Please get it done. At least one day we will say, no cancer cervix. Cool. So can we have some vaccine? Cancer vaccine? Presently, yes, we have 2 vaccinations against cancer. One against this carcinoma cervix, vulva, vagina. There is like ton of cancers that can happen in the areas where you don't want to talk about it, don't want to show about it, don't want to get treated. Get vaccinated. You will not get it. So because HPV is the reason for the 7 to 8 types of cancers, you just get 1 vaccination done. When should I get vaccination done? Ideal age before 15 years. Because according to Western population, you would not have had boyfriend, you would not have started sexual life. But if you have not started sexual life, still you can have only 2 doses of vaccination. But if you have more than 15 years, you have to have 3 doses of vaccination. That's all. 1 injection, 0, 1 and 6. That's it. So, but if you are vaccinated, nange compulsory cancer baralva. How many of you got vaccinated for corona? Agilladre kalsbittirtini. So did you get corona after that? Yes. Similarly, you may get cancer because it's virus. It may have different strains. ಏನೇನು strains ಇದೆಯೋ ಅದಕ್ಕೆ ವ್ಯಾಕ್ಸಿನೇಷನ್ ಮಾಡಿದ್ವಿ. ಹೊಸ strain ಬರ್ಬೋದು. So in 13 you get vaccinated. 30 years start pap smear. Simple. Okay? But your chances of getting cancer like corona, you are not going to go to ICU. You are not going to go to advanced stage. You may not develop cancer. 95% you are protected from cancer. But still we recommend continue because 5% ಇದೆಯಲ್ಲ. So we don't say. So vaccination ಮಾಡಿಬಿಟ್ಟಿದ್ದೀನಿ, ಸ್ಕ್ರೀನಿಂಗ್ ಮಾಡಲ್ಲ ಇಲ್ಲ. If you are 13, get vaccinated. If you are 30, go for pap smear. That's all. Carcinoma endometrium, similar to breast. The couch potatoes will get it, so be physically active. So, please remember, carcinoma endometrium is a very, very silent disease that is coming in most of the women nowadays. Post menopause ಆಗ್ಬಿಟ್ರೆ ಇಲ್ಲ ಈ ಕಡೆ ಆ ಕಡೆ ಬ್ಲೀಡಿಂಗ್ ಆಗ್ತಾ ಇದ್ರೆ ಏನು ಮಾಡಲ್ಲ, ಹೋಗಿ ಗರ್ಭಕೋಶ ತೆಗೆದ್ಬಿಡ್ತಾರೆ. ಅದಾದ್ಮೇಲೆ ಅಲ್ಲಿ ಕ್ಯಾನ್ಸರ್ ಇದೆ ಹೇಳ್ಬಿಡ್ತಾರೆ. ದಟ್ ಇಸ್ ನಾಟ್ ದ ವೇ ಇಟ್ ಶುಡ್ ಬಿ ಡನ್. ಸೊ ಎನಿ ಟೈಮ್ ಎನಿ ಅಬ್ನಾರ್ಮಲ್ ಬ್ಲೀಡಿಂಗ್ ಗೆಟ್ ಅನ್ ಅಲ್ಟ್ರಾಸೌಂಡ್ ಡನ್, MRI ಡನ್, ಅದರಲ್ಲಿ ದಪ್ಪಗಾಗಿದೆಯಾ, ಈ ಥರ ಏನಾದ್ರೂ ದಪ್ಪಗಾಗಿದೆಯಾ ನೋಡ್ಬಿಟ್ಟು ಬಯಾಪ್ಸಿ ಮಾಡಿಬಿಟ್ಟು ಸರ್ಜರಿ ಮಾಡಿ. ದಟ್ಸ್ ಇಟ್. ಓರಲ್ ಕ್ಯಾನ್ಸರ್ಸ್ ಯಾರ್ಯಾರೆಲ್ಲ ಇಲ್ಲಿ ತಂಬಾಕು ಎಲ್ಲ ಇಡಕ್ಕೆ ಜರ್ದಾ ಪಾನ್ ಬೀಡಾ ಗುಟ್ಕ. So we see these things. How many of you know Rajnikant? Everyone knows. They know this also. They know his lip. Have you seen his lip? That is called melanoplakia. For me, it's a spot diagnosis. Okay. He is rich enough to remove all the melanoplakia spots whenever it comes, and that is why he's not developing cancer. Okay, that black spots, you have 35% risk of getting cancers. Okay, so anything becomes red like that, or white like that, or black like that, changing black thing, you have 30 to 35% develop of oral cavity cancers. So that's it. Now coming back to November, lung cancer. How many of you think only smokers will get lung cancers? Raise your hands. Smokers will get lung cancer. How many of you agree with this? No, smokers will not get lung cancer. How many of you agree with this? Not necessarily smokers only will get lung cancer. Unfortunately, Asian women, 33% are getting because of secondhand smoke. That is different thing. Most important thing, without smoking history, nothing. They are just getting mutated, genetically mutated cancer. All of them present as stage 4. Because they are not smokers, we don't screen them, we don't even suspect them. Okay, so that is one possibility, but the treatment is very simple, tablets. But we have to be in lookout of it. So women having cough, back pain, all these symptoms, I say that, blood in sputum, chest pain, breathing difficulty, weight loss, bone pain, headache, or hoarseness of voice, please don't ignore, just get tested. I'm not saying that is all chest pain, nange cancer bantu illa. Okay, don't do that, okay? Yeah. Next, how to do guidelines. There are screening idya lung cancer ke? There is only recommendation is radiation can cause cancer. So don't go and repeatedly get x-rays and CT scan. Don't do it. ನನಗೆ ಭಯ ಬಂತಲ್ಲ ಹೋಗಿ ಎಕ್ಸ್ರೇ ತಗೋಬಾರ್ದು. ಅರ್ಥ ಆಯ್ತಾ? ಸೊ ಓನ್ಲಿ ಲೋ ಡೋಸ್ CT ಸ್ಕ್ಯಾನ್ ಓನ್ಲಿ ಫಾರ್ ಸ್ಮೋಕರ್ಸ್ ಹು ಹ್ಯಾವ್ 20 ಪ್ಯಾಕ್ ಇಯರ್ಸ್. ಅಂದರೆ 20 ಪ್ಯಾಕ್ ಇಯರ್ಸ್ ಅಂದರೆ ನಾನು ಒಂದು ಪ್ಯಾಕೆಟ್ ಸಿಗರೆಟ್ ಐ ಸ್ಮೋಕ್ ಫಾರ್ ಅ ಡೇ, ದಟ್ ಈಸ್ ಕಾಲ್ಡ್ 1 pack. Okay, into number of years becomes pack years. But I smoke 2 packets per day, but I have smoked for 10 also becomes 20 pack years. Got it? So number of packet per day into number of years. So if I smoke 4 packets, even 5 years I have a high risk. Artha aita ivaga? So it is not 20 years of smoking. It is 20 pack years of second hand smoke also. If you are reading for 3 years in the college and your friend is smoking for 3 years and you are always with him, your pack is also the same. You got my point? It's not that avane smoke madidare nan madilla. How many of you stand with your friends and you don't mind him smoking? Somebody is literally sleeping. Okay, so they say if you are 50 to 80 years and you have 20 pack years of history, only between 50 to 80 years you can get this low dose CT scan. If you are above 80, don't do it. Less than 50, don't do it, because if you repeatedly do the CT scan, again you may get lung cancer. So that's all. And if I've stopped, this is one major drama. Okay, I stopped yesterday. Today I should not get cancer. That's a concept, right? But they say, Nana ivattu nilsidre, if I stop today, my risk for a person who has not smoked comes down only after 15 years. Got it? It's not like today I stop tomorrow, but the changes starts happening. That's a good thing. Your risk is coming down to 0, but it's coming down. So stop it today, now. Okay? So are you a good friend or a bad friend? What do good friends do? You should also not smoke. You should not tell others to smoke, and request your friends to stop smoking. Okay? 3 concepts. Definitions are very clear in friend. You go and find a dictionary. Okay? That Matangi definition will be there in that. Okay? Clear? So you are not going to smoke? Ma'am, we have never done it, ma'am. Right? So that's all. So when let us summarize how to be healthy, not for cancer, for anything else. 13, get vaccinated. 20, start examining your breast. 30, get your pap smear done. 40, start your mammography. 50, just go for overall hospital checkup because you can get diabetes, hypertension, heart, ಏನೇನೋ ಡ್ಯಾಮೇಜ್ ಆಗ್ಬೋದು ಬಿಕಾಸ್ ಲೈಕ್ ಓಲ್ಡ್ ಗಾಡಿ ನಾವು ಸ್ವಲ್ಪ ವಿ ಆರ್ ಜಸ್ಟ್ ಗೋಯಿಂಗ್ ಆನ್ ಆ ಸರ್ವಿಸ್ ಮಾಡ್ತಾನೆ ಇರಬೇಕು ಕರೆಕ್ಟ್ನಾ ಗಾಡಿನ ಸರ್ವಿಸ್ ಮಾಡ್ತೀರಾ ಮಾಡಲ್ವಾ ಗಾಡಿಗೆ ಮಾಡ್ತಾ ಇದ್ದೀರಾ ನಿಮಗೆ ಮಾತ್ರ ಮಾಡಲ್ಲ ನಿಮಗೆ ಮಾಡಬೇಕಂದ್ರೆ ಖರ್ಚು ಗಾಡಿಗೆ ಮಾಡಬೇಕಂದ್ರೆ ಸರ್ವೀಸು ವಾಟ್ ಓಕೆ ಸೊ ಪ್ರೊಟೆಕ್ಟ್ ಯುವರ್ ಸೆಲ್ಫ್ ಸ್ಟೇ eat well, sleep well, and keep always. Yes. If you're happy, nothing will come near you. Okay? But if something happens, don't tell me. Probably you didn't smile more. Okay? Thank you for all your questions. And so today, your humble request from me is, we will start a nuclear fission reaction today. If 20 people or 40 people or 60 people are sitting here, I want you 60 to go and talk. Awareness months are created to make you talk, not to make Matangi to talk everywhere. And I keep drinking water. Illa. I make you talk, make you understand, make you aware and not make you scared. Please keep talking. Amma 40 ವಯಸ್ಸು ಆಯ್ತಾ ಮ್ಯಾಮೋಗ್ರಫಿ ಮಾಡಿಸ್ಕೊಳ್ಳಿ ಕಾಯಿಲೆ ಬಂತ ಎದುರ್ಕೋಬೇಡಿ ಡೋಂಟ್ ಗೆಟ್ ಸ್ಕೇರ್ಡ್ ಗೋ ಅರ್ಲಿ ಗೆಟ್ ಕ್ಯೂರ್ಡ್ ಪ್ಲೀಸ್ ಕೀಪ್ ಟಾಕಿಂಗ್ ಅಬೌಟ್ ದೀಸ್ ಥಿಂಗ್ಸ್ ದೇರ್ ಇಸ್ ಸಮಥಿಂಗ್ ಕಾಲ್ಡ್ ಮ್ಯಾಮೋಗ್ರಫಿ ತುಂಬ ಸಿಂಪಲ್ ಟೆಸ್ಟ್ ನಥಿಂಗ್ ಲೈಕ್ ದಟ್ ಬಟ್ ಪ್ಲೀಸ್ ಗೋ ಅಂಡ್ ಗೆಟ್ ಯುವರ್ ಟೆಸ್ಟೆಡ್ ಡನ್ ಲಾಸ್ಟ್ ಥಿಂಗ್ ಪ್ಲೀಸ್ ಟೇಕ್ ಯುವರ್ ಪೇರೆಂಟ್ಸ್ ಫಾರ್ ಟೆಸ್ಟಿಂಗ್ ಆಸ್ ಅರ್ಲಿ as possible whether it is father or mother. Okay, so any questions? Okay, that's a good question. Darlings, please listen. So the most important thing, madam asked one of the most beautiful question is because she was attending my class. If somebody asks questions, which means they are listening to me, understanding, and they're asking questions. So microcalcification on the ತೋರಿಸಿದೆ ಅಲ್ವಾ ಡಾಟ್ ಆಗಿ that can be detected only with a mammography. Self breast examination ಅಲ್ಲಿ ಸಿಗಲ್ಲ. There are two different concepts. Screening andre it is for prevention as well as early detection. When you do self breast examination or clinical breast examination, already gantu bandide, I am only detecting it early. So that is for early detection. Nan dina mutta irodinda nange kaile barbardandre every day everybody will be doing self breast examination. It's not prevention. The first few slides, there is concept in medicine. First is primary prevention, secondary prevention, tertiary. Primary prevention is your lifestyle modification. ಸ್ವಲ್ಪ ಫಿಸಿಕಲ್ ಆಕ್ಟಿವಿಟಿ ಮಾಡೋದು ಒಳ್ಳೆಯದು ತಿನ್ನೋದು ಇದೆಲ್ಲ ಆ್ಯಂಡ್ ಸೆಲ್ಫ್ ಬ್ರೆಸ್ಟ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಇಸ್ ಯು ಬಿಕಮ್ ಅವೇರ್ ಆಫ್ ವಾಟ್ ಇಸ್ ಯುವರ್ ಬ್ರೆಸ್ಟ್ ಆ್ಯಂಡ್ ಚೇಂಜಸ್ ಆರ್ ಎವ್ರಿಥಿಂಗ್. ಸೆಕೆಂಡ್ ಥಿಂಗ್ ಇಸ್ ಅರ್ಲಿ ಡಿಟೆಕ್ಷನ್, ದಟ್ ಇಸ್ ಕಾಲ್ಡ್ ಸೆಕೆಂಡರಿ ಪ್ರಿವೆನ್ಷನ್. ಬೇಗ ಕಂಡುಹಿಡ್ಬಿಟ್ಟು ಬೇಗ ವಾಸಿ ಮಾಡ್ಕೊಳ್ಳೋದು. ಸೊ ದಟ್ ಈಸ್ ವೇರ್ ಯುವರ್ mammography and your self breast examination comes. It is for early detection. It will not prevent you from getting cancers. Tertiary is you got it and you get it treated with the proper organization, the proper correct treatment. So mammography can only detect microcalcification, not by self breast examination. So any questions? I got a question because everybody asked me this question. Yeah, see, I asked so many lists. Did I say LADK? I didn't say beetle nut andre ಎಲೆ. ಓಕೆನಾ? ಅದರಲ್ಲಿ ಅಡಿಕೆ ಆರ್ ಕಡಿ ಪೊಡಿ ಇಸ್ ದ ಕಲ್ಪ್ರಿಟ್. ಸ್ವಲ್ಪ ಜನ ಬರೀ ಕಡಿ ಪೊಡಿ ಹಾಕಿರ್ತಾರೆ, ಅವ್ರ ಅಡಿಕೆ ಪೊಡಿ ಮಾತ್ರ ಹಾಕ್ಕೊಂಡು ಇದು ಮಾಡ್ತಾ ಇರ್ತಾರೆ. ದಟ್ ಈಸ್ ರಾಂಗ್ ಬಿಕಾಸ್ ದಟ್ ಈಸ್ ಇನ್ ದ ಕ್ರಿಸ್ಟಲೈನ್ ಫಾರ್ಮ್. ನೀವು ಅರಿಕಾ ನೆಟ್ನೋ ಎಷ್ಟು ಪೊಡಿ ಮಾಡಿದ್ರೂ ಪೊಡಿ ಆಗಲ್ಲ. ಅದು ಇಟ್ ವಿಲ್ ಬಿ ಇನ್ ದ ಕ್ರಿಸ್ಟಲೈನ್ ಫಾರ್ಮ್. ದಟ್ ವಿಲ್ ನೆವರ್ ಗೆಟ್ ಇನ್ ಟು ಎ ಪೌಡರ್ ಫಾರ್ಮ್ ಆ್ಯಂಡ್ ಯು ಕ್ಯಾನ್ ನೆವರ್ ಡಿಸಾಲ್ವ್ ಇನ್ ಟು ಎ ವಾಟರ್. ಕರೆದೋಗಲ್ಲ, ಯಾಕೆಂದರೆ ಇಟ್ ಇಸ್ ಸ್ಟಿಲ್ ಇನ್ ದ ಕ್ರಿಸ್ಟಲೈನ್ ಫಾರ್ಮ್. ಮೋಸ್ಟ್ ಆಫ್ ದಮ್ ವಿಲ್ ಕೀಪ್ ದಟ್ ಅರಿಕಾ ನೆಟ್ ಕಡಿ ಪೊಡಿನ ಹೇಳ್ತಾರೆ ಇಲ್ಲಿ ಇಟ್ಕೊಂಡು ಬಿಕಾಸ್ ದೇ ಫೀಲ್ ದಟ್ ಬಾಯಲ್ಲಿ ಒಳ್ಳೆ ವಾಸನೆ ಬರುತ್ತೆ. ಓಕೆ, ದೇ ಕೀಪ್ ಇಟ್ ದ್ಯಾಟ್ ಆಲ್ವೇಸ್ ಆ್ಯಂಡ್ ಕೀಪ್ ಚೂವಿಂಗ್. ಅದೇನಾಗುತ್ತೆ, ಚುಚ್ಚಿ ದೆರ್ ವಿಲ್ ಬಿ ಅ ಮೈಕ್ರೋಸ್ಕೋಪಿಕ್ ಗಾಯ ಥರ ಆಗ್ತಾ ಇರುತ್ತೆ. ದೆನ್ ಇಟ್ ಕಾಲ್ಸ್ ಸಬ್ ಮ್ಯೂಕಸ್ ಫೈಬ್ರೋಸಿಸ್. ಬಾಯಿ ಓಪನ್ ಮಾಡೋದಕ್ಕಾಗಲ್ಲ ಆ ಥರ ಇಲ್ಲಿ ಫುಲ್, ಯಾಕಂದರೆ ಅದು ಡ್ಯಾಮೇಜ್ ಆಗಿ ರಿಪೇರ್ ಆಗಿ ಡ್ಯಾಮೇಜ್ ಆಗಿ ಅದು ಫುಲ್ ಎಲಾಸ್ಟಿಸಿಟಿ ಪಿಂಕ್ ಆಗಿರೋದೆ ಬೆಳ್ಳಗಾಗಿ ಎಲಾಸ್ಟಿಸಿಟಿನೇ ಹೋಗ್ಬಿಡುತ್ತೆ. ದಟ್ ಈಸ್ ಬಿಕಾಸ್ ಆಫ್ ದ ಅರಿಕಾ ನೆಟ್. ಐ ಹ್ಯಾವ್ ನೆವರ್ ಟೋಲ್ಡ್ ಬೀಟಲ್ ನೆಟ್. That is one concept. Okay, beetle leaves, not nut. Beetle leaves don't cause cancer. But coming to the original question. Okay, you had too many parts in your question. Okay, so now part 1 I am coming to this. The origin of question that bone density ಕಡಿಮೆ ಆಗುತ್ತೆ, ಅದಕ್ಕೆ ಕ್ಯಾಲ್ಶಿಯಂ ಬೇಕು, ಕ್ಯಾಲ್ಶಿಯಂಗೆ ಬೀಟಾ ಲೈಫ್ಸ್ ಹಾಕಬೇಕು. ಕರೆಕ್ಟ್ನಾ ಮ್ಯಾಮ್? ದಟ್ಸ್ ಯುವರ್ ಕಾನ್ಸೆಪ್ಟ್ ಆಫ್ ಕ್ವೆಶನ್. ಬೀಟಾ ಲೈಫ್ಸ್ ಅಂದ್ರೆ ಕ್ಯಾನ್ಸರ್ ಬರುತ್ತೆ. ಓಕೆ, ನಾವು ಕಮಿಂಗ್, ಐ ಟೋಲ್ಡ್ ಬೀಟಾ ಲೀವ್ಸ್ ಡಸಂಟ್ ಕಾಸ್ ಕ್ಯಾನ್ಸರ್. ನಂಬರ್ ಒನ್, ಇಫ್ ಯು ಆ್ಯಡ್ ಇಟ್ ಲಿಮಿಟೆಡ್, ಎವ್ರಿಥಿಂಗ್ ಅಂದು ಲೈಫಲ್ಲಿ ಲಿಮಿಟೆಡ್ನ ಒಂದಿರುತ್ತೆ. ಲಿಮಿಟೆಡ್ ಮೀಲ್ಸ್ ತಿಂದರೆ ಪ್ರಾಬ್ಲಮ್ ಬರಲ್ಲ, ಅನ್ಲಿಮಿಟೆಡ್ ತಿಂದರೆ ದಪ್ಪಗಾಗ್ಬಿಡ್ತು. ಅದೇ ಥರ beetle leaves are not the only source of calcium. Number one, you have enough calcium in your diet. We don't write calcium regularly. I don't promote calcium because if you, in your food, calcium is enough in your green leaves, milk, curd, you have enough amount of calcium in everything. It is not getting absorbed because there is no vitamin D. ನೀವು ಎಷ್ಟು ತಿಂದ್ರೇನು ಬೀಟಾ ಲೈಫ್ 24 ಗಂಟೆ ಚಪ್ತಾ ಇದ್ರೇನು ಇದು ಇದ್ರೆಲ್ಲ ಕೆಳಗೇನೆ ಹೋಗುತ್ತೆ. ವಾಟ್ ಎವರ್ ಇಟ್ ಇಸ್ ದೇರ್, ಇಟ್ ಸ್ಟ್ರೈಟ್ ಪೈಪ್ಲೈನ್. ಓಕೆ, ಎಸ್ ಮೇಡಮ್, ಗಾಟ್ ದ ಪಾಯಿಂಟ್? ಸೊ ಆಲ್ ಆಫ್ ಅಸ್, ಆ್ಯಂಡ್ ಬೋನ್ ಡೆನ್ಸಿಟಿ ಗೋಸ್ ಡೌನ್ ಬ್ಯಾಡ್ ಓನ್ಲಿ ಬಿಕಾಸ್ ಆಫ್ ಯುವರ್ ಲ್ಯಾಕ್ ಆಫ್ ಫಿಸಿಕಲ್ ಆಕ್ಟಿವಿಟಿ. ಬಿಕಾಸ್ ಲ್ಯಾಕ್ ಆಫ್ ಫಿಸಿಕಲ್ ಆಕ್ಟಿವಿಟಿ, ಯುವರ್ ಮಸಲ್ಸ್ ಬಿಕಮ್ ಲೆಸ್ ಸ್ಟ್ರಾಂಗರ್. ನೀವು ಬಗ್ಗಿದ್ರೆ ಎದ್ದೋಳಕ್ಕಾಗಲ್ಲ, ದಟ್ ಮಚ್ ಇಟ್ ವಿಲ್ ಬಿಕಮ್ ವೀಕ್. And your sunlight exposure. So I am talking about concepts and basics. We are talking about, we damage everything and then we are going for a repair. If calcium can improve bone marrow density, it will not improve. That is why even calcium people have changed from shell cal to shell cal D3. A D3 ಏನು madam? Vitamin D madam. ಅದು ಯಾಕೆ ಮೇಡಮ್ ಟ್ಯಾಬ್ಲೆಟ್ ಆಗಿ ಬಂತು? ವೆಸ್ಟರ್ನ್ ಕಂಟ್ರೀಸಲ್ಲಿ ಬಿಸಿಲಿಲ್ಲ, ನಮಗೆ ಆಚೆ ಇಲ್ಲಿದೆ, ಆದ್ರೂ ನಾವು ಹೋಗಿ ಪ್ರಿಸ್ಕ್ರಿಪ್ಷನ್ ತೊಗೊಂಡೇ ಬಂದು ಅದು ತಿನ್ನಬೇಕು, ಆಚೆ ಹೋಗಲ್ಲ. ಅದಕ್ಕೆ ಹೋಗ್ಬೇಕಂದ್ರೂ ಒಡಿಯೂಸೆ ಛತ್ರಿ ತೊಗೊಂಡು ಹೋಗಬೇಕು, ಛತ್ರಿ ತೊಗೊಂಡೋಗಿ ವಿಟಮಿನ್ ಡಿ ತೊಗೊಂಡು ಬರ್ತೀವಿ. ದಟ್ಸ್ ಅವರ್ ಪ್ರಾಬ್ಲಮ್ ಇನ್ ಅವರ್ ಕಂಟ್ರಿ. ಸೊ ದ ಬೋನ್ ಡೆನ್ಸಿಟಿ ಗೋಸ್ ವರ್ಸೆಂಡ್ ಆಫ್ಟರ್ ಯುವರ್ ಮೆನೋಪಾಸ್. ದಟ್ ಈಸ್ ಅ ಡಿಫ್ರೆಂಟ್ ಕಾನ್ಸೆಪ್ಟ್. ಮೆನೋಪಾಸಲ್ಲಿ ಈಸ್ಟ್ರೋಜನ್ ಇಲ್ಲ ನಮಗೆ, ಮೆನೋಪಾಸ್ ಬಂದಾದಮೇಲೆ ಈಸ್ಟ್ರೋಜನ್ ಇರಲಿಲ್ಲ ಆದರೆ ಬೋನ್ಸ್ ಕೆನಾಟ್ ಟೇಕ್ ಅಪ್ ಕ್ಯಾಲ್ಶಿಯಂ. ಅರ್ಥ ಆಯ್ತಾ ಮ್ಯಾಮ್? ಬಟ್ ದಟ್ at that time, even if you give calcium, it is not going to get placed there. Again, what comes to the concept? Physical activity and exercises. Avaga toning madidre, that will equal, and then your androgens will be produced, which will be taking place of estrogen. So concept is, if you are not doing physical activity, if you are not toning up your muscles, if you are not exercising, none of these prescriptions will correct you. ನೀವು ದಿನ ಎಲೆ ತಿಂದ್ರೇನು ಸರಿ ಆಗಲ್ಲ. And dina ele tindrenu, it is not your regular diet. Only after pregnancy, a lot of people say that dina ಒಂದು ಎಲೆ ತಿನ್ನಬೇಕು. ಅದು ಯಾಕೆಂದರೆ ಆ ಮಗು ದಪ್ಪಗಾಗಬೇಕಾದ್ರೆ ಇಷ್ಟು ತುಪ್ಪ ಕೊಟ್ಟಿರ್ತೀರ, ಅದು ಜೀರ್ಣ ಆಗೋಕ್ಕೆ ಆ ಎಲೆ ತಿನ್ನಬೇಕು. ಆ ಎಲೆ ತಿಂದು ಯಾರಿಗಾದ್ರೂ ಕ್ಯಾಲ್ಶಿಯಂ ಬರುತ್ತೆ ಅಂದರೆ ಯು ಕ್ಯಾನ್ ಟೇಕ್ ಇಟ್, ನೋ ಪ್ರಾಬ್ಲಮ್. ಬಟ್ ದರ್ ಇಸ್ ಅ ಲಿಮಿಟ್ ಫಾರ್ ಎವ್ರಿಥಿಂಗ್. ಅಟ್ ದಟ್ ಟೈಮ್ ಯು ಟೇಕ್ ಓನ್ಲಿ ಒನ್ಸ್ ಎಲೆ, ಬಟ್ ನಾಟ್ ಬಾಯಲ್ಲಿನೇ ಇಟ್ಕೊಂಡು ಅದ್ರ ಜೊತೆನೇ ನಿದ್ರೆ ಮಾಡ್ಕೊಂಡು ಅದ್ರ ಜೊತೆನೇ, ಯು ಡೋಂಟ್ ಡೂ ದ್ಯಾಟ್. ಯು ಡೋಂಟ್ ಕೀಪ್ ಯುವರ್ ಮೌತ್ ಆಲ್ ದ ಟೈಮ್. So these are the problems in that, not LA. Beetle leaf, there is no problem at all. But anything limited. There is a prescription. Neevu problem with Ayurveda and homeopathy and Indian naturopathy medication is nobody know when to take, how much to take, how to take, and other things. It has not come. ಆ ವಂಶವಳಿಯಿಂದ ಕರೆಕ್ಟಾಗಿ ಬಂದಿಲ್ಲ. ಎಲ್ಲಾದ್ರೂ ಏನಾದ್ರು ಅವರೊಬ್ರು ಹೇಳಿದ್ದಾರೆ ಪೆಪ್ಪರಿಂದು ಚೆನ್ನಾಗಿರುತ್ತೆ ಅನ್ನೋ, ಪೆಪ್ಪರ್ ರಸಮ್, ಪೆಪ್ಪರ್ ಫ್ರೈ, ಪೆಪ್ಪರ್ ಅದು ಇಲ್ಲಮ್ಮ, ಪೆಪ್ಪರ್ ಎಷ್ಟು ತೊಗೋಬೇಕು ಅವ್ರು ಹೇಳಿರೋದು ಮರ್ತೋಗ್ಬಿಡ್ತೀವಿ. ಬಿಕಾಸ್ ಇಟ್ ಹಸ್ ನಾಟ್ ಕಮ್ ಟು ಮಿ ಆಸ್ ರೈಟ್ ಪ್ರಿಸ್ಕ್ರಿಪ್ಷನ್. ಐ ಹ್ಯಾವ್ ನಾಟ್ ಗಾಟ್ ಟ್ರೈನ್ಡ್. ವಿ ನೋ ದಟ್ ಪೆಪ್ಪರ್ ಇಸ್ ಗುಡ್, ವಿ ನೋ ಟರ್ಮರಿಕ್ ಇಸ್ ಗುಡ್, ವಿ ನೋ ಮಿಲ್ಕ್ ಇಸ್ ಗುಡ್, ವಿ ಡೋಂಟ್ ನೋ ಹೌ ಮಚ್ ಟು ಟೇಕ್. ಸೊ ಆ ಕಾಲದಲ್ಲಿ ಬೆಣ್ಣೆ ತೆಗೆದಿಲ್ಲ ಆದರೆ ಮಜ್ಜಿಗೆ ಮೊಸರು ಮನೆ ಒಳಗೆ ಬರಲ್ಲ. ಇವಾಗ ಫುಲ್ ಮಿಲ್ಕ್, ಫುಲ್ ಕ್ರೀಮ್ ಮಿಲ್ಕ್ ಆ್ಯಂಡ್ ಬೆಣ್ಣೆ ಫುಲ್ ಅದು ತಿಂದೇನೆ ನೆಕ್ಸ್ಟ್ ಕೆಲಸ. ಸೊ ದಟ್ಸ್ ನಾಟ್ ಈಕ್ವಲೆಂಟ್. ವೆನ್ ಯು ಆರ್ ಟೇಕಿಂಗ್ ಕಾನ್ಸೆಪ್ಟ್ಸ್, ಯು ಹ್ಯಾವ್ ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ದ ಕಾಮನ್ ಸೆನ್ಸ್ ಬಿಹೈಂಡ್ ಇಟ್ ಅಂಡ್ ದೆನ್ ಟೇಕ್ ದ ಕಾನ್ಸೆಪ್ಟ್ಸ್. Thank you for that wonderful question. Very nice. I'll include that slide next time.
Ma'am, good afternoon.
Yes, ma'am.
And the question, mobile towers ಎಲ್ಲ ಕಡೆ ಇನ್ಸ್ಟಾಲೇಷನ್ ಮಾಡಿರ್ತಾರೆ.
Yes, ma'am.
ಅದರಿಂದ ಬರುವಂತ ರೇಡಿಯೇಷನ್ ಇಂದ ನಮಗೆ ಏನಾದರೂ ಎಫೆಕ್ಟ್ ಉಂಟಾ?
ಚೆನ್ನಾಗಿ
Number 2,
Yes, ma'am.
5G speed of internet, is it going to cause us some harm? Question number 3, overhead tank with the plastic overhead tank. Third question, ma'am, non-stick cookware. I think I'll stop here. Thank you, ma'am. Microwave oven also is included, ma'am.
Yes, ma'am. So 5 marks, ma'am. Okay. Okay. I have to now get 5 out of 5. Please listen, okay? This is rapid fire round. Initially on the small Nidana Kelbita rapid fire round. First question was our cell phone towers. Yes, they are very clearly told that cell phone towers are creating brain tumors in children. That is why people had towers in non-residential areas. Now they are not aware. Leave alone towers, your cell phone creates radiation, your laptop creates radiation, but you sleep with your cell phones and you talk about cell phone towers. You want signals, but you will be sleeping. How many of you sleep with your cell phones under the pillow? All of us. It has maximum amount of radiation, number one. Number two, madam, sorry, one question of 5 marks I get koltini, okay na? So I cannot answer in one line. Second thing, why infertility clinics are increasing in metropolitan cities, not in rural cities, only in metropolitan cities? Because of your ಲ್ಯಾಪ್ಟಾಪ್ಸ್. ಯಾರೋ ಹೇಳ್ಬಿಟ್ಟಿದ್ದಾರೆ ಲ್ಯಾಪ್ಟಾಪ್ ನೆಟ್ಟರೆ ಲ್ಯಾಪಲ್ಲಿ ಇಡಬೇಕು. ಆ ರೇಡಿಯೇಷನ್ ಎಲ್ಲಿ ಹೋಗುತ್ತೆ ಅಂತ ಎಲ್ರಿಗೂ ಗೊತ್ತು. Sorry for saying this. The three things: couch potatoes, weekend parties, and laptop radiation. You are done. You ಏನೋ ಒಂದು ಮಿಲನ್ ಇನ್ಫರ್ಟಿಲಿಟಿ ಸೆಂಟರ್ನ ಹೋಗ್ತಾ ಇರ್ತೀರಾ, ಖರ್ಚಾಗ್ತಾ ಇರುತ್ತೆ. ಅಲ್ಲಿಂದ ಲಕ್ಷದಲ್ಲಿ ಬರುತ್ತೆ, ಇಲ್ಲಿಂದ ಲಕ್ಷದಲ್ಲಿ ಹೋಗ್ತಾ ಇರುತ್ತೆ. ಸಿಂಪಲ್. ಅದೇ ಪೇಷಂಟು ಕೋವಿಡ್ ಟೈಮಲ್ಲಿ ಎಲ್ಲ ಫರ್ಟಿಲಿಟಿ ಬಿಕೇಮ್ ಆಲ್ ರೈಟ್. All the patients who went for infertility got all right during COVID times. Hengama. No stress, no travel, timely food, good sleep, happy life, they all got fertile. So radiation is not just from the tower. Obviously, there is a big study that said that cell phone tower hatra idre aa manegalalli iro makkalige brain tumors barta ide. They have documented it. But I don't know how many of you have cell phone towers above your house. That ಬಾಡಿಗೆ ಕೊಟ್ಟರೆ ಎಲ್ಲರೂ ಒಪ್ಕೊಳ್ತಾ ಇದ್ದಾರೆ. That is up to you. Second thing, second question, ma'am. Sorry, question paper leak ಆಗ್ಬಿಡಿ. Ma'am, overhead tank plastic. Excellent question, ma'am. I don't recommend that. That is also plastic. There is nothing called non-plastic. ಅದು ಬಿಸಿಲಲ್ಲಿ ಇದ್ರೆ ಇನ್ನು ಬೆಂಕಿ ಆಗ್ತಾ ಇರುತ್ತೆ. It's not advised. Okay, third question, ma'am. Non-stick cookware. Very good. Non-stick cookware non-stick ಆಗಿ ಇರೋ ತನಕ ಅದು ಒಳ್ಳೆಯದು. ಅದು ಯಾವಾಗ ಸ್ಟಿಕ್ಕಿ ಆಗಿಬಿಡುತ್ತೆ, ಯು ಹ್ಯಾವ್ ಟು ಥ್ರೋ ಇಟ್ ಅವೇ. ಬಿಕಾಸ್ ನಾನ್-ಸ್ಟಿಕ್ ಅಲ್ಲಿ ದೇ ಆಲ್ವೇಸ್ ಸೇ ದಟ್ ಯು ಹ್ಯಾವ್ ಟು ಯೂಸ್ ವುಡನ್ spatulas, but most of us use metal. You have to throw it away. But we don't have the heart. ಈಗ 1000 ರೂಪಾಯಿ ಕೊಟ್ಟು ತೊಗೊಂಡು ಬಂದೆ, ಆ 3 ತಿಂಗಳು ಆಗಿಲ್ಲ, ಈ ಥರ ಮಾಡಿಬಿಟ್ಟಿದ್ದೀರಾ. Then it is not still non-sticky. So you can use non-stick unless it is becoming sticky. Because once that chemical is gone, it becomes reactive. ಒಳಗೆ ಇರೋದು, it is only, what do you call EM? It's like sort of indalium ಥರ. It's a hybrid of, alloy of aluminum, which is not healthy. So aluminum vessels are never recommended. Aluminum vessels are the most cheapest. So aluminum vessels, please don't use for cooking. That is the most toxic thing, either for any dabbas or for cooking. They are very easily, it can be heated because it's very thin metal, so most of them use it. Aluminum, indalium. Those days when they were using indalium vessels, they were using not to use turmeric and all those things, because these all will react. If you see that if you pour oil and keep it, after half an hour, it will change into green colors. That shows that these are all toxic. This is the way we find out whether that metal is reacting or not reacting. Microwave oven, I don't recommend. They say it causes cancerous. Like, because the most commonest places which has cancer is China, Japan, and all those Southeast countries has highest number of cancers. Why? Why do they have cancers? Because they don't steam their food. You know, in China, the street food is fried rice. They don't eat fried rice. Please kindly understand. So microwave oven or fried items are suttu tinodu. Barbecued items are all carcinogenic. That is the commonest. See, from Western countries we brought breast cancer because of Western lifestyles and burgers, pizza and everything. Because of fried rice, Ajinomoto and all these things from, you know what is the commonest disease in China? Cancer. And because of only barbecued items and fried rice. We have brought it from there and we will get those things. So microwave, I don't recommend, ma'am. Probably you can use it in conventional type, but not in microwave type. Yes. So this clapping means please close the session. Ade tane. Yeah, please, yeah, we'll go for Zumba. I'm also tired. Only these muscles are working for a long time.
Thank you so much, Matangi ma'am. The session was really interesting, informative, right? Hope we'll follow at least few things to maintain a healthy lifestyle. Is it so? Just saying yes is not a thing. You have to follow. Clear? Yes. Thank you, ma'am.
Okay, we can't leave the college without thanking the authorities. Such wonderful arrangement. Thank you, Principal Ma'am, Shakuntala Ma'am. Thank you to Prashant Sir. And Doctor, every time I hear you, you get better and better and better. Thank you so much, Dr. Matangi. Thank you to Amrinda from the Indian Cancer Society, Yuvraj, Praveen from the Indian Cancer Society. And there are a lot of people. I know the effort Mahesh has put in to coordinate the entire thing along with Veena. So I thank all the Oracle volunteers. But I have to say that there are many people who have worked behind. They are not present on the stage, but thanks to all the staff, the faculty, Jairam sir, the students, thank you for your very attentive listening. And girls, you'll go back and you will talk about your vaccination. Yeah, you'll start your breast self examinations. You will go and talk and take your parents, as doctor said, because this is just not awareness. From awareness, you need to go into action. Then only we think we have actually done something. We are absolutely delighted that we made this possible today. And ma'am, you were excellent. You have a good skill. Keep it up. And thank you very much. God bless all of you. Remain healthy and happy. Thanks a lot.
Yes. Thank you, ma'am. Now I would like to call upon Srimati Vidya Shrikant, faculty from PU department, to deliver the vote of thanks.
Be thankful for what you have. You'll end up having more. If you concentrate on what you don't have, you will never have enough. Good morning to one and all. I deem it a great honor to propose the vote of thanks on this memorable day. It has been such an honor to be a part of this wonderful event. Praise the Almighty for this memorable event. On behalf of Adarsh Group of Institutions, I thank the Oracle volunteers, Indian Cancer Society for organizing the breast cancer awareness program and the lung cancer awareness program. And my sincere thanks to the main speaker and the star attraction, Dr. Matangi. Thank you, ma'am. We still have a lot of queries. I think we should get back to you now after some time. I would like to thank all the consultants from the Indian Cancer Society and the volunteers from the Oracle Company. I also extend my thanks to Dr. Shakuntala, Degree Principal, Dr. Prashant S., PU Principal, the teaching staff, the non-teaching staff, and of course, my dear students. I think you are privileged to hear this talk and this awareness program. You can spread the message of the cancer awareness to your friends, neighbors, your family members, and one and all, whoever you know and you come across. Thank you once again. Thank you all.
Thank you, ma'am. So now I request our principal ma'am, Dr. Shakuntala Samuelson, to honor our Oracle and ICS volunteers with a token of respect, gratitude, and affection. Thank you all. Thank you, ma'am. I would like to conclude today's program by saying living a healthy lifestyle can prevent chronic diseases and long term illness. Feeling good about yourself and taking good care of your health is very much important. Maintain a healthy lifestyle by doing what is right for your body. So, thank you everyone. Have a good day. Students, you are informed to assemble in the prayer hall for the Zumba, followed by the play card march. Later, the refreshments will be arranged in the canteen. Thank you everyone. Have a nice day.
Halamati Habibu, Halamati Habib Vandale, Halamati Habibu, Halamati Habib Vanda, Halamati Habibu, Halamati Habib Vandale, Halamati Habibu, Halamati Habibu. Malama pita pita de, malama pita pita de, malama pita pita de, malama pita de, malama pita pita de, malama pita pita de, malama pita pita de, malama pita de. Holi holi, பக்கத்துல சிரிப்பு ரங்கோலி, ஜாலி ஜாலி, பக்கத்துல மயங்குற டோலி.
ಗಾಲಿ ಗಾಲಿ ಮೊತ್ತಲ್ಲ ಅವನುಂದ ಗಾಲಿ ಜಾಲಿ ಜಾಲಿ ಹಡಿಪೋಳಿ